ourselves, right? Okay. Good afternoon, everyone, and welcome to the hearings of the Health and Government Operations Committee. I'd like to run through a few guidelines before we begin our hearings. We would ask that anyone who received the Zoom link not share that link. Staff will not allow anyone to testify who was not invited to testify to the hearing. I would ask you, anyone who is listening, to encourage folks to watch the hearings on YouTube. The sponsors of bills are allowed 5 minutes to speak. They may designate that time to another as they see appropriate to the bill. All other witnesses will be given 2 minutes to speak in support. And then we'd ask that folks stay in the hearing until the delegates have the opportunity to ask questions. After those who are in support, we will have those in opposition be given 2 minutes each to speak. And we'd ask again that you stay in the hearing so that the delegates may ask questions. Please conclude your remarks when you see the timer finish. Members must remain with your video on camera during the entirety of the hearing. And members, I will remind you that we'd ask that you ask only one question of one witness. If you have other questions, you may follow up. And for those who are testifying today, we ask that one person answer a question. So pick the best person on the panel to respond to a question. With that, we will begin with the first bill of the day. That is HB 535, Delegate Acevero. That is Maryland Sign Language Interpreter Act. Delegate Acevero, welcome to the committee.
Hold on, he's not with us yet. Give me 1 minute.
Okay. We haven't. I would point out while we're waiting is that we do have sign language interpreters with us today for this bill, and closed caption is also available. If you are on Zoom and at the bottom of the screen, you'll see live transcript. And if you click on that, you should get the closed caption. If we don't have Delegate Acevero yet, I will go to his first witness. Is he here, Melissa?
I've texted the Acevero delegate.
Okay. Okay, then we will allow the delegate to go right after, but we're going to start first with Tara Congdon, please. Tara, are you here?
Hello, I am.
Okay.
Before we begin, I just would like to ask whoever is running the meeting, could you please spotlight my video so that people who are watching can see me, because currently the people who are watching on YouTube are only able to see the video of the interpreter because the audio is coming from the interpreter. So can you manually pin or spotlight Tara Congdon's connection?
Can you do that, Melissa?
Yeah, but I'm working on it.
Okay.
Okay, thank you. All right. So has my time started now?
Not quite. Look, can we do the timer behind the scenes, Melissa?
Yeah, that's fine.
Okay, great. Thank you. Okay, so when you're ready, Tara, start.
And sorry, to recap, 2 minutes or 2.5?
2 minutes.
All right. Honorable Chairman and members of the committee, thank you for having me here today. I'm here to talk about the human cost of not having interpreter licensure. Throughout our fertility journey, my husband and I interacted with several interpreters. In my written testimony, I describe several examples of individuals who represented themselves as qualified when they were not, and who caused harm to me and my family. As one example, during what should have been a simple ambulatory procedure with no recovery time and a $100 copay, an uncertified interpreter consistently mistranslated information in both directions, causing confusion between myself and my doctor. As a result, I had to have invasive surgery under anesthesia, miss days of work, and pay thousands in surgery bills. As a second example, in another incident, our first embryo transfer, our doctor's office hired an uncertified interpreter. As soon as she started signing, it was obvious that she was not fluent. I then looked to my husband for help understanding the nurse's instructions. The interpreter then stepped in between us and told me not to look at him, but at her. She talked to me like I was incompetent and a child, and constantly mistranslated what I was signing. Finally, I had had enough and asked her to leave, and she refused. We tried then explaining to the doctor what was happening, but the interpreter interjected and told him that I was being difficult. Understandably, I became very upset at the level of disrespect and became scared about what this would mean for the embryo transfer and if that would disrupt the process. After the interpreter was finally forced out, the doctor wasn't sure if we should proceed because I was so upset, and he was worried that the negative emotions could affect the success of the transfer. But we had no choice, because if we didn't proceed, the embryo would have to be discarded. I did become pregnant, but 12 weeks later, she died. The interpreter, however, got paid for the full assignment and never faced consequences. After that, I fought to be able to choose interpreters myself and carefully chose qualified ones. The second transfer went smoothly, so did my pregnancy, and we had a beautiful daughter this past summer. That said, we would like her to have a sibling, which means we'll have to go through the entire process again. I hope that it is not fraught with the same frustrations. I and other deaf consumers need protection from incompetent, unethical interpreters. We need a way to hold them accountable and prevent them from harming us. We have protection from bad lawyers, doctors, plumbers, and even hairstylists, but not interpreters who literally have our lives in their hands. Please help us by voting yes.
Thank you very much for sharing your story. I understand that Delegate Acevero is in the room now. So Delegate, we'd like for you to speak now.
Thank you very much, Madam Chair, and thank you to the members of this committee. Apologies, I was in my committee and we're currently having hearings, but I got over here as fast as I could. I want to thank Tara for her very powerful testimony, and for the record, Delegate Gabrielle Acevero presenting House Bill 535, the Sign Language Interpreters Bill. And colleagues, really, I think Tara's testimony was a powerful one and spoke to not just the need for this bill, so I wouldn't spend too much time speaking to it, because I think she really summarized not only the need for this bill, but how it would not only protect parties, but also ensure that deaf people who live with a constant reality that their voices are never truly heard through a number of ways, have the opportunity to participate in society, have the opportunity to be respected as they should. And this bill would protect them and ensure that their voices, particularly when it comes to seeking services, as Tara described, that they're able to do so and they have someone that's competent that would be able to provide that interpretation service. So this bill, House Bill 535, creates the State Board of Language Interpreters. The board would, in essence, regulate individuals who provide sign language interpretation services in our state. I just want to point out to this committee, according to the director of the governor's office of hard of hearing, Maryland is the only state with no regulation of sign language interpreters. This bill, House Bill 535, seeks to address that by establishing a regulatory framework for the licensure of individuals who provide sign language services, interpretation services rather, And at the heart of it, as I mentioned earlier briefly, it is about consumer protection. We've heard too many harrowing stories. I myself, Tara shared her story about the kind of experience that deaf Marylanders each and every single day deal with. And this bill is well overdue for all of our constituents who are placed in a dangerous and life-threatening situation because they don't have someone to rely on to provide quality interpretation services, and that's critical. So this, if you look at the bill, it speaks to also the fiscal note, and I just want to point out that the modest cost to businesses and agencies relying on sign language interpreters is more than outweighed by the enormous increase in the quality of life that House Bill 535 would provide to deaf Marylanders, such as Tara and so many others, hundreds of thousands across our state. And so this bill is not only necessary, colleagues, but it is time that we do right by deaf Marylanders. It is time that we provide some regulation around sign language interpreters and let people know that they are both in as well as a part of our society. And for far too long, we have not done that with deaf Marylanders. And this is a good step in the right direction. And so I ask for a favorable report. And I thank you all very much. And I thank Tara again for her very powerful testimony that I think speaks to the importance of this bill way more than I can ever can. Thank you.
Thank you, Delegate. I'd like to call on Stephanie Summers, please.
This is the ASL interpreter. Before Stephanie begins, okay, just needed to be able to pin her. I can see her just fine. And Stephanie is also requesting, could the pin be placed on Stephanie Summers' video feed? Thank you. Hello, everyone. Hello to the chairperson and members of the committee. I'd like to talk a bit about the bill from the Maryland Interpreter Licensure team that has been working together on this bill. We emphasize that this is a consumer protection bill. And according to Director Brick, Director of the Governor's Office of Deaf and Hard of Hearing, as was just said, Maryland is the only state that does not have any sort of legislation or oversight of sign language interpreters. Some of you may be wondering why it is that we've housed the bill under the Department of Labor. And this is because ODHH is a partisan office, meaning that it serves at the pleasure of the governor, with the purpose of advising the governor on matters pertaining to deaf and hard of hearing Marylanders. With both ODHH's advice and the mechanisms afforded by the Department of Labor for licensure, we believe that the two can work in tandem along with a licensure board, an independent licensure board. There are some businesses in Maryland that already follow the practices outlined in this bill. They believe in the spirit of what we're proposing. The businesses who would oppose the bill are ones who have been hiring non-qualified, non-certified, and in some instances, fraudulent interpreters. The practice is being done because there's no regulation or enforcement and no consequences. There are also agencies who take advantage of these non-qualified interpreters, then leading the interpreters or the people purporting to be interpreters to think that they're qualified for the assignments that they're being placed on, when in fact they are not qualified to do the job. You've just heard a horror story like Tara's. You're going to hear another harrowing story from Pegfaulkner. And unfortunately, Tara and Peg represent countless other stories throughout the state of Maryland, and we want to stop these situations from happening. We've heard numerous complaints, or we've lodged many complaints, but our voices have not been heard. It is high time that our voices are heard, and we need this bill to protect our lives in legal and medical situations from having interpreters who are not qualified in those very vital situations. Thank you for your support and for voting for HB 535. Thank you.
Thank you, Ms. Summers. I'd like to call Tracy Eisen, please.
Hello. Could the sign language interpreter please be pinned? Thank you. Hi, my name is Tracy Eisen. I'm a sign language interpreter that practices in Maryland. I am also a small business owner in Maryland. I'm a leader in the Maryland and DC interpreter community and a CODA, which stands for Child of Deaf Adult. American Sign Language is my first language, and I grew up in a deaf community as a person with hearing. So picture this, I'm a child visiting my physician for the treatment of severe allergies. The doctor's office assistant who knows some sign language is interpreting the doctor's visit to my father. I can hear the doctor speaking and see the assistant using sign language, interpreting the doctor's instructions. I see that many of the words I hear the doctor saying are left out in sign language. And as the doctor visit completes, panic begins to sweep over me and I do not feel safe. At 6 years old, I don't know how to explain to my father that the interpreter did not sign the same thing that the doctor said. Luckily, later at home, I'm able to communicate with my father in sign language. And he reaches back out to the doctor's office to confirm the directions for my treatment and finds they were indeed incomplete. I'm safe this time. My parents' close friends, also deaf, however, were not as lucky. They had an infant with a medical condition, which was being treated by the same doctor's office. The instructions they received through the same unqualified interpreter brought harm to their baby. And as a result, the child was removed from the deaf family's home. This continued my entire life and probably the reason I chose to become an interpreter. 35 years later, I no longer have to fear for my father's life and his safety as he lives in a state with interpreter licensing regulations. It is clear that deaf people in Maryland are not safe until regulations for practice of sign language interpreters are in place. I stand for the deaf community being heard, and you have the power to put an end to the exploitation and harm coming to deaf citizens in Maryland by addressing the practice of sign language interpreters, and I request you do that with urgency. Thank you for your listening.
Thank you. I'd like to call Peggyfaulkner, please. Ms. Faulkner?
Should I begin? I'm here.
Okay.
The video,
Okay.
the pin needs to be placed on Ms. Faulkner's video.
I think we have it now. Thank you.
Okay. Hello to the chairman and the members of the committee. My name is Peggyfaulkner. I'm a student at the University of Maryland, and I'm here to share my experiences with unqualified interpreters at school and on my internship, which have affected both my education and my employment on my internship with the police department. On several occasions, non-qualified interpreters were hired. In one instance, a person who had recently moved to the US from Japan was placed in a class. This person had only recently begun to learn American Sign Language. They did not know how to spell many common terms, even as simple as probable cause. Their lack of qualifications among interpreters on my internship could have also had negative effects on victims in doing our investigations. Luckily, my coworkers were often able to detect these errors before we proceeded with our investigations, but it nevertheless was really disruptive and upsetting to my supervisor. In school, in another situation, my law professor also became very frustrated with an interpreter who was unqualified, unfamiliar with legal vocabulary, and had to interrupt the professor's lecture so often that it became disruptive and took too much class time from the rest of the class. While I was in class, was trying to teach this interpreter vocabulary. I should not be having to do their job for them on the job. I then went to the director of disability at the university and expressed that enough was enough. I hope that this makes clear that we need a law to ensure that qualified interpreters are placed on appropriate assignments in order to protect deaf Marylanders from other frustrating experiences such as mine. Thank you so much for your time and attention.
I want to thank all of the speakers on the sponsors panel for bringing us this information and your stories. I'd like to open it now for questions from the committee. Please use the raise hand signal if you have a question for any of the presenters. Delegate Johnson.
Thank you, Madam Chair, and whoever's best to answer this question. I like this bill, but I would like to ask, will it, because this covers a wide range of services that have to provide an interpreter. So will they know when they need to have an interpreter on location for certain appointments? And do we have enough interpreters to fulfill the language in this bill?
Delegate Acevero, do you think that you have the answer, or perhaps Ms. Summers has the answer to that question?
I'm happy to answer that.
Okay, great, thank you.
Thank you.
The pin needs to be placed on Ms. Summers' video feed.
Ms. Summers, there we go.
Thank you for that question. In the state of Maryland, we have well over 500 registered interpreters. We do see that it is possible then to meet the needs across the state among those who are certified and can become licensed. We do not foresee an issue around interpreter supply because we have such a strong infrastructure in our state that allows for a pipeline of educated, qualified interpreters. So we don't see that being an issue for our state.
Okay, and the first part of that question, will a service know when they need to have an interpreter on location for an appointment?
Ms. Summers,
The interpretation was still being conducted.
sorry.
It's just ended. So to recap, your question is, how do agencies know when they need to hire an interpreter? It's always by request. So whenever an interpreter places a request, then an agency screens their interpreters and selects an interpreter that's a good fit for that assignment. If the state of Maryland requires interpreters to be licensed, then it simply means that an interpreter has to hold a licensure, and being certified is a prerequisite to being licensed. So that means any interpreter who is licensed will also be certified. Does this address your question?
Yes, thank you. Thank you, Madam Chair.
Thank you, Delegate. Delegate Saab for a question.
Thank you, Madam Chairman. I'm just trying to figure out, why are we having the Department of Labor be the place where the board would sit? It just seems to me that the better place for the board to be regulated by is the Office of the Deaf and Hard of Hearing, the governor's office. So I'm just wondering, why is it at the Department of Labor, and do they have enough expertise to manage and run the board? Or is there any ability to, with the delegate, to explore the possibility of moving it as an amendment from the Department of Labor to the GODHH?
Delegate Saab. Yes, thank you, Madam Chair. Delegate Saab, I appreciate the question. It's a good question, and I apologize to the committee. I was supposed to have mentioned that that we have been working with a number of advocates and impacted folks on this bill. And we do believe that it should also be in another agency, and I'm certainly open to that. And in fact, I think we did suggest having it in the governor's office. And so that is definitely something that is going to be amended. We've had discussions about that. I was supposed to have mentioned that there are a couple of favorable amendments to the bill, and that being one of them. But thank you for flagging that. It's a good point and definitely one taken. And we will be making sure that this this is in the right office or agency.
I appreciate it. Thank you. Thank you, Madam Chairman.
Thank you, Delegate. Delegate Bagnell?
Thank you, Madam Chair. I wanted to ask about this letter from the Maryland Judicial Conference. Two concerns. Is there specialized training to work within the judiciary? Because they identified that they work with interpreters who are licensed under the National Interpretation Certification or under the Registry for Interpreters for the Deaf, but also have they reached out to you, Delegate Acevero, with any sort of amendments or a path to ensure that they don't lose interpreters, but also that that we're able to do this in the state of Maryland?
Appreciate the question, Delegate. I have not received any communication from the judiciary, and that's just speaking for my office. But as with all bills, I am open to any amendment that would strengthen the bill while also maintaining the intent of the bill, which is to ensure, one, consumer protection, right? Because that's at the heart of this, but two, ensuring that deaf Marylanders are able to go about their day and participate and be able to have interpretation services, and there be some kind of a regulation, and that's at the heart of the bill. So definitely open to amendments that would strengthen it, but I have not been in communication with the judiciary. No.
Thank you. Thank you, Madam.
Thank you. Delegate Lewis.
Thank you, Madam Chair. Thank you, everyone, Delegate Acevero, for this bill and your panel. Ms. Faulkner asked or brought up a good point. She referred to an deaf language interpreter, an ASL interpreter from Japan, who wasn't able to fluently communicate in American Sign Language. I'm aware that there is, in this country, another form of sign language called Black American Sign Language that is understandable, but quite different. And I'm curious to know if in Maryland, we have Black American Sign Language interpreters, if there are a sufficient number of them to serve the community that speaks that language predominantly, and would they be included under this legislation? Whoever's best to answer that question, and thank you again.
Yeah, thank you so much, Delegate. I'll defer to our panel, but I appreciate you just pointing out that, yes, there is a Black American Sign Language that, you know, a lot of folks are familiar with, particularly in our community, and I appreciate that. And as I've said earlier, we want this bill to be inclusive as possible to ensure that we're helping as much people as possible. So however we can strengthen it, we're certainly open to that. But I appreciate you pointing out that really important piece. I'll defer to the panel to speak to just some of the other questions that you asked.
I think you've answered the question, Delegate, so I think we're good. Thank you for that.
Okay, all right.
Delegate Krebs.
No, I appreciate bringing attention to this issue, but I was just thinking we don't just have interpreters for ASL, we have interpreters for many different languages. And how do we deal with this with spoken language? You know, obviously people have different levels of all the different languages that are required, especially in the medical profession. So how would this pertain? I mean, would this be leading us into doing that for all interpretation?
Delegate Acevero?
Yeah, so this bill deals specifically with ensuring that we are regulating sign language interpreters. I can't say that, you know, it covers anything else. The intent of this is ensuring that deaf and hard of hearing Marylanders are able to go about their daily business, right? I recognize that there are a bunch of languages and interpretation services that are provided. But I think when we look at the issue at hand right now, which is deaf and hard of hearing Marylanders, there is an issue of interpretation services, reliable, good interpretation services. I think this is an issue that, you know, we want to focus on, but also recognizing that, yes, we do offer interpretation services, but sign language interpretation services is not regulated, and we're the only state to not do that. So that's what the focus of the bill is.
Thank you.
Delegates. Chairman Pendergrass.
Thank you, Madam Chairman. I heard the first witness, I believe it was, say that some of the advocates at least do not want this in the Office for Deaf of Hard of Hearing because it is a political office and they felt that it was better left in the licensure office. I'm not sure what is an answer to this. So I'd like to ask the sponsor if he has talked to anybody in the administration. I noticed that this bill has no comments from the administration whatsoever, at least in my file, about where it belongs. Have you met with them? Have you worked with them at all?
Yeah, appreciate the question, Delegate. We have not been in communication with the administration about where this should be. As you, excuse me. Yeah, we have not been in communication with the administration. We've been working with the advocates, the advocacy groups, and impacted folks. And as I said earlier, you know, I'm open to amendments that will strengthen it, but I am also leaning on the advocates, the deaf and hard of hearing community to sort of direct me on how this bill can really make their lives convenient while also ensuring consumer protection. So I don't want to say that I have a preference where this should be. I would defer and I would rely on what deaf and hard of hearing Marylanders are saying and where they believe this office should be so that it could ultimately be helpful. And I'm open to that.
Well, I think that maybe what would be helpful to the committee is if you had those conversations with the administration, if the advocates are speaking with one voice. First of all, we need them to speak with one voice. Then we need you to be working with the administration and see how this kind of a bill could be implemented, because this is somewhat new territory and we do want to get it right. So I'd appreciate it if you would do that work before we have a good hard look at this bill.
Since this is new territory, I'm going to break our rule and ask Tara Cogden to respond to the question that the chairman raised. I understand you had a comment that you wanted to make.
Yes, hello. Can the pen be placed on Tara Congdon's video feed?
There we go.
Hold on 1 second for the interpreter. Okay. Dr. Krebs asked about spoken language interpreters as opposed to sign language interpreters. I did want to offer a point of clarification here. The law actually does not require the presence of spoken language interpreters in many situations, but it's the Americans with Disabilities Act that actually requires sign language interpreters in institutions like legal settings, medical, educational settings, as a matter of access and providing a reasonable accommodation on the basis of deaf people's disabilities. So that's a key distinction between the provision of sign language interpreters and spoken language interpreters. So when the law requires that sign language interpreters be provided for interactions with deaf patients or legal clients, et cetera, the law does require that, yet the ADA does not go so far as to say what qualified is or means. So states have filled in that gap with licensure to further define what it means to be qualified in providing this accommodation. So I, again, just wanted to make that clarification to make the distinction between the provision of sign language and spoken language interpreters. Hopefully that helps.
Thank you. I appreciate that. I want to thank the sponsor and his panel for their stories and information. And I'm now going to call a panel of favorable with amendments. We're going to start with Michelle Westfall.
Can the pin be placed on Michelle Westfall's video?
There we go.
Great, thank you. Hello, my name again is Michelle Westfall. I'm the chair of the Maryland Advisory Council on Deaf and Hard of Hearing, also called MAC-DHH. My position on this bill is favorable with amendments. We have 3 pieces of feedback to be considered. First, according to research that we have done on Maryland's One Stop website, Maryland does have other agencies that issue licenses according to that agency's subject matter expertise. The Governor's Office on Deaf and Hard of Hearing is the subject matter expert in this regard, regarding interpreters. So again, GODHH is the subject matter expert. The Department of Labor does not have that level of subject matter expertise, if any at all. So again, we reiterate that GODHH is the most appropriate agency for this bill. If the Maryland Department of Health, Transportation, Agriculture, and others can issue licenses, why not GODHH? To the second point, currently in this bill, on the fiscal and policy note, the analyst points out the confusion in the bill as written about who it is that's in charge. We believe that if GODHH is designated as the sole agency in charge, that will also avoid any potential misunderstanding or confusion from occurring. Additionally, if you look at the 2020 Joint Chairman's Report, JCR, you'll find that in the GODHH's segment of the report, they are also in favor of option number 1. Option number 1 should be incorporated into this bill. Finally, nobody on the Maryland Interpreter Licensure Committee reached out to any member of the MAC-DHH for our input at any point in the development of this bill, or the cross-filed bills for that matter. The community members of MAC-DHH unanimously agree that we do not want to be listed as having a seat on the proposed board. We feel strongly that the list of board members currently outlined in the bill should remain generic and not go so far as to become specific. Thank you.
Thank you. Gabrielle Davis, please.
Is the sign language interpreter. The person labeled Joe Lucas is going to provide the spoken language interpretation.
Okay.
Good afternoon. My name is Gabrielle Davis, and I'm here to represent the BHP Coalition. And you might be wondering who that coalition consists of. It's Baltimore City, Howard County, as well as Prince George's County. And so those deaf associations from those 3 counties have made a coalition. And we've been involved as we've watched the development of this bill, and we've seen the Maryland Association for the Deaf, as well as others, work on developing this bill. And we've done our due diligence, and we've got 4 amendments. I'd like to mention 2, whereas another person will go into some more detail about the remaining 2 amendments. Something I'd like to emphasize is about VRI, which is video remote interpreting. If the state of Maryland decides to pass this licensure bill for sign language interpreters, we have to consider video remote interpreting and how that would be covered. Because services may not want to provide video remote interpreting in the state of Maryland, or they may go to VRI interpreting settings if they have to get a license in the state of Maryland. And so if interpreters have to be licensed in the state of Maryland. So that is a concern for us. Also in the bill, I think the word control is not the right word. And when I'm talking about what needs to be done, interpreters are not supposed to be speaking for deaf people, but rather just there to facilitate interpretation. And so the word oral should not be used because it's not speaking, but rather facilitating communication. Also, I have another amendment that I wanted to mention that another person will go into, but that's all for me. Thank you.
Thank you. Elka Peters, please.
Can you pin Elka, please?
Elka. Yeah.
Okay, hopefully everyone can see me. Making sure the interpreter can see me. Okay, great. Good afternoon, Madam Chairman and members of the committee. My name is Elka Peters, and I live here in Howard County, and I have so for 12 years. I've been working with the Howard County Association for the Deaf, HCAD, for quite some time now, doing a lot of work. And I am in favor of the bill HB 535 with 4 amendments. 2 amendments have already been addressed by Gabrielle Davis. Plus, we've already submitted those amendments to Senator Kingle, so hopefully you will support those amendments. So I'm going to address the final 2 of the 4 amendments. So I'd like to talk about the Office for the Deaf and Hard of Hearing. There's already been some remarks about the Office for the Deaf and Hard of Hearing during today's hearing. In the bill, it's saying for the purpose of establishing the State Board of Sign Language Interpreting in the Maryland Department of Labor is currently how it's phrased. But it should be phrased in the Office of the Deaf and Hard of Hearing. And the reason is because the Office for the Deaf and Hard of Hearing are the subject matter experts in the deaf and deafblind community, and they know American Sign Language and the issues that confront deaf people and American Sign Language, including the interpreting issues, because they are the experts on that. Whereas Department of Labor may or may not have the background and expertise in that, and that's why this bill should be housed under the Office for the Deaf and Hard of Hearing. Now, the Howard County Association for the Deaf did host a town hall last year where we talked about the sign language interpreting licensure to the community at large. We also had a long discussion about what people wanted, and we used the Menti-Mentor for a voting mechanism to be able to collect data from the community. And as such, the members voted saying that they want the Office for the Deaf and Hard of Hearing to be where it is housed. So much so that it was 92%. And I can relate to that because the Office for the Deaf and Hard of Hearing is the subject matter expert for this bill. I'll refer to subject matter expert as a SME. Now moving on to the fourth and final amendment and talking about the overall consistency of the board. Right now it says 5 deaf people and 2 interpreters. I think that it should be a little bit more balanced as far as the makeup of it. It should be 3 interpreters from the interpreting community who are considered to be experts within the community, along with 1 representative from an interpreter training program to be placed on the board, and then 2 deaf representatives that are selected from within the deaf community, and then 1 deaf-blind representative for a total of 8 members or representatives, plus a consultant to provide advice, experience, and expertise on the regulatory and legal aspects of managing a bill. Possibly the director for the Office of Deaf and Hard of Hearing, or possibly somebody who's a chairperson of an interpreter training program, but someone who's quite seasoned and who can take the helm for this board so there's diverse perspectives that are made up of this board. Now, moving on to another part, I just wanted to mention briefly, based on my own personal experience, and share a little anecdote with you. When I was in labor in a hospital, I was lying there and there was an interpreter there, and I had my husband Rob beside me as well. And the interpreter was present saying that there was a car in a ditch up and down. My husband saw me getting anxious. I was getting ready to give birth, and my husband decided to take over and explain what was happening and said the car went into a ditch and got stuck in the ditch 3 times and then finally came to a standstill in the ditch. It's kind of the same concept of pushing 3 times and then stopping when you're actually in labor. And so that was the whole concept that was trying to be conveyed, but I was not understanding it through that interpreter. And so that is a memory that I have of that experience. And so that interpreter might know and have a foundation in American Sign Language, but maybe does not actually have the expertise in translation and interpretation, because that's a whole nother skill set. And so maybe this person was not ready to actually do translation and needed to receive more training and have more depth in understanding of interpreting. And that's where licensure would come into play, to be able to push and encourage interpreters to get more training and to be evaluated so that they can be placed in appropriate settings. That way, the deaf and hard of hearing and deaf-blind consumers are protected. And so I think that it is key that this bill has passed, and we need to have a strong pool of qualified sign language interpreters and reduce the number of unqualified, fraudulent, and unethical interpreters. Thank you.
Thank you.
May I speak?
Fred Hartman, please.
Good afternoon, everyone. Chairman of the committee and committee members. This is my first time testifying, so I have learned a lot from you guys. So I've been involved with this, as well as 3 prior people who have testified. And I wanted to talk about the Office for the Deaf and Hard of Hearing versus Department of Labor. We've done a lot of research. And by research, I mean we've reached out to different organizations across the state of Maryland. And we've made personal phone calls to presidents and vice presidents of deaf organizations and asking them what they know about the licensure bill. And a lot of them didn't know that licensure bill was even before the state. And so we did a lot of explaining, talking about the planning that was going on. And we talked about the Maryland interpreter license in general and what the goals and outcomes were, just to do some education and give them some options. almost all of the people ended up being in favor of empowering the Office for the Deaf and Hard of Hearing because the knowledge of and expertise that that office has. And we had a legislative awareness day last year, and it was a statewide event that allowed for a lot of discussion. And as a part of that, we did polling through the Menti polling system, and 81% of people were in favor of placing the licensure bill under the Office for Deaf and Hard of Hearing, whereas only 5% said that it didn't matter and could go to any kind of generic hearing organization such as the Department of Labor. So it is very clear there. And what Elka was just saying, that 92% of people are in favor of this bill, and then plus what I'm talking about, the 81% of people being in favor of the Office for Deaf and Hard of Hearing is a strong majority. Now, I would like to go and share something on a personal note. I had surgery on my shoulder last month. I'm okay now, by the way, but I did have to go to the hospital, and I did have to use video remote or VRI interpreting that came wheeled up on a screen to me to use. And the doctor was explaining what kind of medication was needed that they were going to put in through an IV, but the interpreter did not understand what the physician was saying and was not qualified to interpret medical jargon or terminology. And so I had to speak up and ask for repetition for the medical terms. And I realized that the interpreter was not qualified to work in the medical setting. Additionally, I teach American Sign Language, and I have done so for 33 years at a community college level, specifically preparing students to become interpreters and get trained as interpreters. And I've worked with thousands of interpreters over the years. And there are a lot of students that agree that there should be certification and licensure for sign language interpreters in the state of Maryland. I know that I had a student who was in one of my level 2 classes, assuming you understand that level 1 would be the beginning. And this level 2 student was interpreting at his church. And I had to step in and let them know that I recommended to that person that they needed to pass all of their coursework and wait until they became a certified interpreter. But that person disregarded my recommendation and interpreted in church, even though personally, I was not comfortable with their level of signing. It was not fluent. So again, I support this bill with the 4 amendments that have been elaborated on. Specifically, I want to emphasize the Office for the Deaf and Hard of Hearing as the main priority amendment out of the 4 of them. Thank you and have a good day.
Thank you very much. I want to thank all of the folks who came to talk to us about to offer amendments to this bill, and now open it to questions from the committee. Are there questions from the committee for these individuals? Delegate Bagnell.
Thank you very much, Madam Chair. This is just a question in terms of the certification or licensure. Are there specialized are there specialties within the licensure, and would that be something that that the board would define, or is that something that we need to look at as we're evaluating this bill?
So only one person may answer. Not sure who believes they're the best person to answer this question. Just raise your hand.
I think perhaps Mr. Hartman.
Mr. Hartman or Miss.
We can get Mr. Hartman pinned, please. Sorry, I'm a little confused with the screens and Zoom and everything. If you could repeat the question, because I kind of lost the interpreter during all that and couldn't see the question. If it could be repeated, please.
Certainly. In terms of the licensure certification, are there specialized licenses and can you specialize in training when we're looking at things like judiciary and hospital settings and other settings? Is that something that we would need to look at with this bill, or is that something that the board would be able to interpret?
Okay, this is Mr. Hartman. I can go ahead and answer that question. If you could pin him. First of all, I'd like to say that all interpreters are required to pass a certain requirement so that they can enter the field. And then if an interpreter would like to specialize in the legal field, they have to take additional coursework that would be offered by various organizations. For example, when talking about medical interpreting, a doctor, for example, gets their MD degree, but that's not the end of their learning or their education. They can choose to specialize. For example, they may specialize in ophthalmology or in some kind of other subfield or setting. And it's the same thing with interpreters. They may choose to specialize in one of those areas. For example, could be educational, or it could be in legal, and if so, they would have to do additional studying to be qualified in those areas. And we know which interpreters, or a pool of interpreters, are qualified for those specific settings. And there are different pools of interpreters that are qualified for different settings. Hopefully that answered your question.
That did. Thank you very much.
So I don't see any other questions from the committee. I do want to let people know that this bill will be discussed further. So there will be the opportunity for folks to make these recommendations and work through what it looks like some work that needs to be done on the bill, but we have a very good start. Seeing no other questions from the committee, that finishes the work, completes the hearing on HB, let me get the number right, 535. And I want to thank everyone who came to testify. I want to thank the interpreters for being here today. And we hope that you'll be able to continue with us as we move forward on this bill. So thank you very much. And we will go to the next set of bills. So for those, thank you. For those who are here for the bills about the Maryland song, there are 3 bills that are whose purpose is to repeal the Maryland song. Each of them has a different sort of way of doing it. But in order to make this process most efficient, we're going to work a little differently than we have with other bills. We're going to hear from all 3 sponsors first, and we'll have the opportunity for the committee to ask questions of the sponsors. Then we're going to have a panel of folks who are favorable, and when you come up to talk about which bill you are favorable or that you are favorable, please designate the bill number that you are speaking to. And then we will have a panel and we'll have questions after the favorable panel. And then we will have a panel of those who are unfavorable, and we'll have time for questions after that. So we will begin with Delegate Hughes, who is the sponsor of HB 667. Delegate Hughes.
Thank you, Madam Chair and members of the HGO Committee. Today, I'm pleased to introduce for you House Bill 667, the state song repeal. This is a simple, straightforward bill, and I believe that the decision we have as a committee is simple and straightforward as well. House Bill 667 will repeal the state song because of its reference and connection to Maryland's racist past, and that is all the bill will do, be repealed. I am bringing this bill before you today because I believe lyrics matter. I remember growing up in the American Legion Junior Girls Auxiliary. I used to sing this song all throughout the state of Maryland. Now I have a greater appreciation for what the lyrics truly mean. I also believe that symbols matter. I was very proud to be a part of the process when 2 years ago, the statue of Chief Justice Taney was removed from our grounds. And since then, we have added monuments that I believe our state can be much more proud of here in the State House, Frederick Douglass and Harriet Tubman. Through this action, we were able to show what our beliefs are through symbols, and we have a chance to do the same with House Bill 667. We saw a perfect example of this on January the 6th, when the crowds of the people who rioted at the Capitol that day were spurred on by toxic words and actions of a man that they looked up to. And that crowd were symbols of racism and hate that those people risked their lives to hold up with pride in front of the entire nation. Those events were scary to watch for many reasons, least of all that I know it will inspire more people to hold those abhorrent beliefs. I know firsthand what happens when people who revere the Confederate flag feel empowered. I knew this before I ran for office, but I knew this even more so just recently when we overrode the governor's veto for the long gun bill, as I was asked by a local news station to weigh in on a local businessman in Princess Anne that had gallows there showing his displeasure with our veto override and showed the nooses that he wanted to use to hang the very people who voted to override the bill. Now, as you know, I am the only Democrat on the Eastern Shore, and I was the only one. So I think that was a direct message to me. So again, symbols matter, as do lyrics. So Maryland by Maryland, the state song pleads for Maryland to answer the Confederacy call to war, to spurn the Northern scum, and it calls President Lincoln a tyrant for abolishing slavery. These sentiments are wholly unacceptable. And I believe that the General Assembly stands for, and we need to know that this has stained the pages of our laws for too long and it's unacceptable. So as you will hear from our panel today, that I am certainly not the first legislator that believes that this needs to go. But I am certainly hopeful that I'll be the last one to introduce this bill about this that needs to be changed. What you will also have in what you for your reading is a letter of support from the state archives, the Attorney General, the Comptroller, and various individuals throughout the state of Maryland in support of this legislation here today. So again, I would like for you, the committee, to urge a favorable report and ensure that House Bill 667 is able to repeal the state song. Thank you for your time, and thank you, Madam Chair.
Thank you, Madam Speaker Pro Tem. Delegate Hill is here to present House Bill 389. Delegate Hill.
Thank you, Madam Chair and committee. The Speaker Pro Tem just spoke very eloquently about why it is past time for our state song, Maryland by Maryland, to be repealed. And like me, she has spent her entire legislative career here in the House in this committee and has heard, as so many of you have, year after year, bills for repeal being offered. The first year that I was a member of HGO, we also had a report from a commission work group that was put together that reported out on the importance of repealing the state song and what we might use to replace it. So I'm not going to repeat the kind of rationale for why this song needs to be repealed, because I think the Speaker Pro Tem was quite eloquent. What I will do is explain that my bill both repeals the state song, as does the bill we just heard, also creates a mechanism for replacing it, having the Maryland Arts Council sponsor a competition, a public competition. Now, having heard many bills and lots of testimony and talked to members of this committee through the years, there are lots of feelings about what we should do to replace the song and what that competition should look like, and should we have a competition. There are even members of this committee who've expressed a desire to see the song repealed and not replaced at all. And so what I've done is reintroduce legislation that along with then Delegate Chris West and now Senator Chris West, who is the sponsor of this bill's cross-file, what we offered back in 2016, which is again, repeal, replacement with the competition, and incorporation as part of the competition without the writers of the songs or the sponsors of the songs having to independently resubmit them. Each of the songs that were offered to this committee for consideration as the new state song. So they're automatically put into the bill, and you can see in the bill that they're referenced. And it also would allow or ask at the end of the competition that the Arts Council would come back with finalists to this committee and the Senate committee and the governor. And that the Arts Council could also make a suggestion that one of the 3 finalists be chosen as the state song. They could stay neutral as to which of the 3, and they could also make a recommendation that we not replace the state song at all. The 6 options for state songs that were in the Arts Council or the committee's report are also included automatically in the competition. So I think this is an inclusive bill. I think most importantly, it has no fiscal note, because the organization to promote and sponsor and handle the competition already exists and can handle the competition with an existing budget. So with that, I offer this as both a combination of the bill that you just heard and the bill that you are about to hear presented by Delegate Resnick. Thank you.
Thank you, Delegate. And Delegate Resnick is here to present House Bill 437.
Thank you, Madam Chair and members of HGO. Thank you to my fellow state song repealers. I want to echo everything they have said. This is, I think, my 4th or 5th year putting in this kind of legislation. It is long past due for us to take this next step and strip away the last remnants of the honors that we bestow onto the Confederacy. It is very long past due. I'm going to echo everything that Delegate Sample Hughes and Delegate Hill said, and I'm just going to add 2 additional points. The first one is a bit of an anecdote. When I filed this bill this year, because of COVID, all the COVID restrictions, I didn't go back to my office after I left the clerk's office. I went back to my car. I put the extra copies that we get of all of our legislation in the back seat with the intent of bringing it back to the office later during session. A few days later, I was driving with my family, and my daughter, my eldest daughter, who is 8, picked it up and asked me what it was. And I told her that it was a bill that I had filed to get rid of our state song. And she asked me why, and I explained why. And she didn't quite understand. So I told her, why don't you read it, and I will explain to you line by line what is said in our state song and what James Ryder Randall meant when he wrote those lines. And she did, and she's 8, and she did a really good job reading, actually. But we went through line by line. And when we were done, my wife, who was in the passenger seat next to me, turns to me and says, you know, when you read it line by line like that, it sounds even worse than it actually, than when you hear it all together. And it really highlighted for me how awful, how offensive, how inappropriate our state song is. And we know that. We know that because whenever we hear the state song sung in public, and thankfully much less often these days, we only hear 2 stanzas. And let's be honest with ourselves. If we were really proud of this song, we would hear the whole song. But we're afraid to sing the whole thing because it is so inappropriate and so offensive. So I think it's well past time to get rid of it. The second thing I will add is my sort of twist on what Delegate Hill is trying to do is find a very appropriate way to replace this song. And part of that is, in the past, we have heard, well, we can't repeal the song without a replacement. Well, we can, but if we do want to try a replacement, you know, I put together what I call the State Song Advisory Committee. It does include the State's Arts Council, but it also includes the archives, the state archives, who are very, you know, important in our state to make sure that that we preserve the historical references and the history of our state. And they can come up with a way to best replace the song, whether it's a competition or commissioning through Maryland artists and performers or some other way, they can come up with a way. And the reason I decided on this was, if you recall that that study that Archives did that Delegate Hill referenced a few years ago, they said that a state song should be adopted based on sort of a groundswell of popularity amongst the people of the state, that it shouldn't be arbitrarily chosen. Well, the reality is our current state song was pretty arbitrarily chosen. There wasn't really much of a groundswell for it in 1940. But nevertheless, I took their point to heart. And I think that we do have to find a way that adopts a new state song in a popular way. And it can take time. Virginia, the capital of the Confederacy, repealed their state song in 1997 and didn't replace it for 15 years until they found the right song to replace it. So I think it's perfectly appropriate for us to take time. I'll be honest with you, I don't care which way we go, whether it's Delegate Sample Hughes's bill or Delegate Hill's bill or my bill. We need to get rid of it. And in due time, I think we will find an appropriate replacement. So I want to thank you all for your time, and I ask for a favorable report on one of these three bills or all three of them.
Thank Delegate Resnick and Delegate Hill and Speaker Pro Tem. Are there questions of the sponsors of the bill? Give you time to raise your hand. So you all made an excellent case. I'm seeing no questions from the committee. So I will call the panel of favorable. So when you are speaking in favor of the bill, please, if you have a particular bill that you want to speak to, please let us know the number or the sponsor. So we have Howard Dennis. We're going to start with you.
Thank you, Madam Chair. I asked for a favorable report for House Bill 667. Maryland has the only state song that calls for the violent overthrow of the government. It's a song of hate written by a Maryland expatriate when he was in Louisiana, refers to Abraham Lincoln as a tyrant, says derogatory things about many people. I first got interested in this bill way back in the day when I was sitting next to William S. James, who was then president of the Senate from Harford County. We were at a baseball game. And right after the national anthem, he said, "You know, Howie, I can't sing the Maryland song." I said, "Why not?" And he whipped out a picture of one of his ancestors from the Civil War. He said, "This ancestor of mine was killed fighting for the Union, and Maryland has a song that supports the Confederacy." So I said, "Billy, if I put in a bill to repeal the state song, would you testify and say just that?" He said, "Yes, I did." And he did. And so I'm very, very proud to have been part of the long history of those who have advocated to repeal the song. It's in the state code, of course, as the state poem in 1939. And I think the history of that was that before Baker versus Carr, each county had one senator. So the Eastern Shore was pretty much dominating the state Senate. And they exercised more strength than perhaps they do now or would have otherwise. But we're all past the point where a state song such as Maryland has is appropriate. I don't personally think that I am a good enough songwriter to pick another song, but I think that repeal is what should be done as a step one, and then maybe at a subsequent time, rather than to get one thing mixed up with another, just to see if the legislature wants a state song, and if so, how we should go about getting it. Thank you.
Thank you very much, Howie. It's great to see you.
Thank you. Nice to
I haven't seen you in a while.
Thank you. Thank you.
Virginia McAmer.
Good afternoon. I am representing the Women's Democratic Club of Montgomery County and many others. This is my third time before the committee. We are urging you to finally take action to repeal our Confederate state song. regardless of whether it's replaced. So that would be HB 667. Maryland is the only state in the country that has a Confederate symbol for its state song. Really, it's no different than flying the Confederate flag over the State House. And while it represents our history, it's a shameful history, a history of slavery, segregation, bigotry. I have friends who grew up in segregated Maryland, and they will never forget the pain and humiliation and discrimination. Speaker Jones has called for its repeal. The Maryland State Archives has called for its repeal. The Montgomery County Council has called for its repeal. The Baltimore Sun in its editorial called for its repeal and called it a toxic song. The University of Maryland Marching Band refuses to play it before athletic events. This year, the Jockey Club said it would no longer play it before the Preakness. And even Congressman Raskin has weighed in and called for its repeal and authored an alternative song as an example of one we can all sing proudly. As has been mentioned, the horrific events of January 6th, which we all watched with a scaffold and noose and Confederate flag being flown in the halls of Congress, should tell us all that these symbols are still representative of hate, fear, and insurrection today. Maryland must stop honoring the lost cause with its Confederate state song. Your committee has the power to reject our segregationist past, to complete that story and send a different message to Maryland that all belong here. So I am asking you, please bring this bill finally to a vote, and please vote yes on this bill. Thank you.
Thank you. Reverend Kobe Little.
Good afternoon, Madam Chair. I'm Reverend and members of the committee. I'm Reverend Kobe Little. I represent the Maryland State Conference of the NAACP. I'm delighted that this year there are 3 bills calling for the repeal of the state song. I've worked with Delegate Resnick in the past and others. Today, I'm here principally in support of House Bill 667, sponsored by our Speaker Pro Tem. But I am in agreement with everyone else that the main point is that we need to repeal this song. It has already been mentioned, but I'll mention it again. It was a horrific sight to see the symbols of white supremacy flying in the United States Capitol. White supremacist symbols, names, and other imagery not only are a threat to our democracy, but they are still a very real and present threat to people who have been victimized and terrorized by white supremacy for centuries in this country. Now, the Maryland General Assembly must take action to protect our democracy and to protect our citizens from terrorism. Yes, white supremacy is terrorism in the United States. Whether it's the Ku Klux Klan, or it's a Confederate flag flying, or it is a Confederate poem that becomes a state song, or even if it is a state seal with the image of a fisherman and a farmer, white men, who were no doubt enslavers and colonizers, invaders. These symbols must go. And all of the symbols of our state must be representative of all of the people of our state. They must be symbols that point to the hope of democracy, the hope of diversity, the hope of inclusion, the hope of equality under the law. White supremacist symbols are not intended to do any of those things, and they do not do those things. And so I do urge this committee to use your power to advance democracy in America, to fight domestic terrorism in Maryland by giving this legislation, any one of these bills, a favorable report. Thank you, Madam Chair and members of the committee, and a special thanks to the sponsoring delegates.
Thank you, Reverend. Mr. Jared Schablein?
Jared's not going to be testifying today.
Okay. Ms. Amber Green?
Yes, I'm here. I'm submitting this testimony in favor of House Bill 0667 on behalf of the Lower Shore Progressive Caucus. The caucus is a political and activist organization on the Eastern Shore, unaffiliated with any political party, committed to empowering working people by building a progressive movement on the Lower Eastern Shore. The song has been a rallying cry for white supremacists and other extremists to commit acts of racial terror on the Eastern Shore, both in the past and to this very day. I also sit on the City of Salisbury Lynching Memorial Task Force, and a group of activists, we were successful in removing a Confederate marker from our Wacomico County Courthouse lawn. That removal of that marker was not to remove history, was not to reteach history, but it was to remove a demonstration that was only put there to enact terror to the Black community. There was 2 lynchings that happened in that very same spot that the Confederate marker had. His name was Matthew Williams, and there was Garfield King. There was also another unknown victim that was killed and murdered as a result of those lynchings. 3 people in Wacomico County have been lynched due to racial terror, and that terrorism has continued to happen even now when we look at our current school systems and we look at our current justice system. The state song is nothing but a rallying cry for white supremacy. And as someone who runs an arts and social justice organization called Phoenix Youth Project, I work with youth and they understand how powerful words are and how powerful music can be. And when I brought this conversation to them, it was set us off. This song is racist. And so I want to just reiterate that art is a powerful tool. It can set the tone. As we've seen Sam Cooke, a change is going to come. This song, we need change. And so I'm just going to say that I repeal this, and for these reasons, the Lower Shore Progressive Caucus supports this bill and recommends favorable report to the committee.
Thank you, Ms. Green. Manaz Islam, please.
Dear Chairman Pendergrass, Vice Chair Pina Melnick, and members of the Health and Government Operations Committee. My name is Manaz Islam, and I'm a student at the University of Maryland, College Park, and I ask that you vote in favor of HB 389 to replace the state song for these reasons. Maryland, My Maryland must be retired as it is not representative of our Maryland. The current state song was written during the Jim Crow era, an era that we collectively agreed must be left in history. This legislation would ensure that Maryland is no longer associated with the inappropriate rhetoric from the state song, which supports our state joining the Confederate Army. It's incredibly important that we display our pride as Marylanders. The state song does the complete opposite. It is embarrassing to take pride in calling the Union Army Northern scum. It is embarrassing to take pride in advocating for the overthrow of the United States government. And it is especially embarrassing that our state school, the University of Maryland, refuses to play the state song at athletic events. Why don't we focus on what is great about Maryland? We take pride in our natural beauty. We take pride in our diversity. 4 of the top 10 most diverse cities are in Maryland. Our state song is an audacious reminder to these residents that we take pride in conserving racism. History is important for 2 things, remembering the past and correcting the present. Our state song will always be a part of history, and so will changing it. I therefore ask that you vote in favor of HB 389 to replace the state song. Thank you.
Thank you, Ms. Islam. So that concludes the favorable panel. I open it now for questions from the committee. Give you a minute. So apparently you all spoke very well and compellingly, and there are no questions from the delegates. Thank you all for providing your testimony and being here today. So now I'm going to call a panel of unfavorable, and we'll begin with Terry Klima.
Thank you very much. I appreciate this opportunity to testify in opposition to the various House bills for the repeal and replacement of Maryland, My Maryland. Sadly, this song has been much maligned with false claims. The song has racist connotations, condones slavery, and advocates the overthrow of the government. All these claims are patently false. Historically, the song enjoyed immense popularity within the state well before its official adoption in 1939, and was showcased along with the Star-Spangled Banner at the 1915 Panama Pacific National Exposition in San Francisco. The state even commissioned a commemorative coin for this event, featuring the images and works of James Ryder Randall and Francis Scott Key. A common criticism of the song involves the usage of the term despot and tyrant, presumably a reference to Abraham Lincoln. How else would one describe the untold constitutional deprivations endured by Marylanders at the hands of an occupying military force? Examples include the suspension of habeas corpus, the unconstitutional arrest of citizens, including members of the legislature and judiciary, and threats to destroy Baltimore City. Rather than a clarion call to join the Confederacy, the song is an important reminder of the indignities Marylanders suffered when constitutional protections were not upheld. There have also been aspersions that the song directly or indirectly endorses slavery. Slavery was unfortunately sanctioned by the United States Constitution until December 6, 1865, when the 13th Amendment was ratified. Lincoln's Emancipation Proclamation freed those slaves in the Union states, including Maryland. Ironically, rather than repudiate the practice of slavery, Maryland Unionist legislature ratified the controversial Corwin Amendment on January 10, 1862, which would have prohibited in perpetuity any attempted federal intervention to abolish slavery. Our state song chronicles Maryland's unique history and should not be replaced. I ask for an unfavorable recommendation. Thank you.
Thank you, Mr. Klima. John Zabilian.
Good afternoon. Do you hear me?
Yes, we do. Thank you.
Very good. I'd like to speak opposing all three of the bills. I'm adamantly opposed to the repeal of Maryland, My Maryland as our state song. Composer James Ryder Randall speaks to the most tumultuous period in Maryland's long history. Maryland, My Maryland drips history. Few people are knowledgeable of its verses or origin because it is no longer taught or sung in Maryland public schools, unlike when I was in elementary school. Some claim that the song is racist, yet there's not a racist word in it. It speaks of despotism, and despot fits Mr. Lincoln's administration. Maryland had not seceded, yet her citizens were denied their constitutionally guaranteed protections, as Lincoln unilaterally suspended the right of habeas corpus. Never mind that the Constitution only allows temporary suspension when authorized by the legislative branch, not the executive branch. Maryland suffered flagrant constitutional abuses, which include unlawful imprisonment of hundreds of citizens, violation of freedom of the press, speech, and Second Amendment rights. Talbot County Circuit Court Judge Richard B. Carmichael was literally dragged from the bench during court by federal troops and pistol whipped before being incarcerated in Boston for signing a writ of habeas corpus. Also arrested and held without trial were Baltimore police commissioners, city council members, a Maryland congressman, and finally, members of this very legislature, including the Speaker of the House, all of whom spent months jailed in Pearl Harbor. In Boston Harbor. Repeal of Maryland, My Maryland would be yet another act of cancel culture. As a veteran of 2 tours in Vietnam and during Desert Storm, I resent the removal of historical monuments, just as I oppose the repeal of our state song that captures Maryland's darkest hour. I urge this committee to resist the temptation to alter more of Maryland's historical past.
Thank you, Mr. Zabilian. Vince McAvoy.
Vince is not going to be with us today.
Okay, so that concludes this panel. I will now open it to questions from the committee. Questions from the committee. Okay, you as well were very clear in your testimony. There are no questions from the committee, and that concludes the work on House Bills 669, 389, and 437. Thank you all very much for your time and your testimony today. And we will move to House Bill 540, Delegate Morgan, Interstate Occupational Therapy Licensure Compact. Delegate Morgan. Delegate Morgan.
Delegate Morgan, you need to unmute yourself. We're still having a hard time hearing you, Delegate.
Technical difficulties.
You may want to log
Yeah.
out and come back in. Seems like you
Yeah,
have a problem.
he
Yeah.
doesn't seem to be muted, but we can't hear him, so.
So we'll give him a minute to go out and come back in, and we'll start with Rachel Faulkner. You'll hopefully have sound.
Hopefully. Can you hear me?
Yes.
Okay, great. So hi, Rachel, members of the House and Government Operations Committee. Rachel Faulkner here with the Maryland Occupational Therapy Association in strong support of House Bill 540, which would enter Maryland into the Interstate Occupational Therapy Licensure Compact. And I want to say that I think this is the fourth compact bill that you all have heard this session. So I'll try to be brief. So this compact was developed partnership by the American Occupational Therapy Association and the National Board for Certification in Occupational Therapy. And this is the first year that the compact is available for legislation in states. It requires 10 states to pass identical legislation. And currently, we're told that there are 12 states that have introduced bills. And another 2 or 3 are interested in introducing legislation this year. So with the 10 state requirement, it looks very likely that Maryland could be among one of the first states to enter, and that the compact could actually become implemented in the next year or two, because we'll have met that threshold. A couple of other things to think about. So Virginia has already passed their compact bill for occupational therapists and occupational therapy assistants. So when we think about regionally how this could benefit states, or how this could benefit occupational therapists and then folks seeking occupational therapy services, with Virginia looking to pass legislation, Delaware planning to introduce legislation, and Pennsylvania still considering it for this year, it does look like we could have a great workforce boost just within our region. Some of the benefits, obviously telehealth, when we talk about how services are delivered across state lines, improved continuity of care, and how employers are able to recruit occupational therapists, particularly in areas where they're close to the border, and occupational therapists may not be inclined or able to get single state licenses in multiple states. So this is certainly a benefit. I think my time is up, but I'm certainly available to answer questions. Thank you.
Thank you. Is Delegate Morgan here yet?
Hi, Madam Chair. Hey,
Sound. All right.
good to see you. You know, we're all learning with the Zoom thing. This was the first time I actually had to use the link to log back into the committee. And I guess for some reason, you know, I just assumed since I was on the committee, I could click the unmute button, but y'all couldn't hear me. So I'm back logged in. Good to see everybody where I would be sitting at the witness stand. This is House Bill of 540. We've heard a bunch of compact bills before. I think the committee understands them, understands the difference between compacts and reciprocity. This is pretty important for areas like mine down in Southern Maryland, where we're on a peninsula and bordering on Virginia there, but not a lot of like services and medical providers. So bills like this are important when you start looking at healthcare from a supply and demand perspective. And anytime we can increase healthcare professionals and increase that pool, increase the supply, we definitely have the demand. And I think a bill like this is helpful for our citizens down there. And with that, I'd be happy to answer any questions and hopefully get a favorable review. Thank you.
Thank you, Delegate. We'll hear from Christopher Arnold.
Thank you, Madam Chair. My name is Christopher Arnold. I am the Northeast Region Liaison for the United States Department of Defense, operating under the direction of the Undersecretary of Defense for Personnel and Readiness. Our mission is to be a resource to state policymakers as they work to address quality of life issues for military families. And it's good to be here again. And on behalf of the department, we appreciate the opportunity to support the policies outlined in House Bill 540 and would like to thank Delegate Morgan for sponsoring it. Joining the compact before you today will improve access to care and allow military personnel and spouses to more easily maintain their certifications when relocating. DoD pivoted in its approach towards licensure after 2017 to consider occupational license compacts as another alternative to improve portability for military spouses. Compacts establish common understanding of competency and its measurement within the occupation, and then seek to have states approve the compact through legislation. Military spouses are a cross-section of the American population, although a greater percentage of them are in licensed occupations than their civilian counterparts, and they are significantly more mobile. Compacts can provide seamless reciprocity for military spouses in an occupation. House Bill 540, the Occupational Therapy Compact, or OT Compact, addresses these licensing issues affecting our service members and their families. The purpose of the OT Compact is to facilitate interstate practice of occupational therapy with the goal of improving public access to occupational therapy services while preserving the regulatory authority of states to protect public health and safety through the current system of state licensure. Portable employment opportunities support military spouse career development. Section 6 of the OT Compact allows an active duty service member or their spouse to designate a home state where the individual has a current license in good standing. This state then serves as the individual's home state for as long as the service member is on active duty, while adhering to the laws, rule, and scope of practice in Maryland. The coronavirus pandemic demonstrates that interstate licensing compacts can provide a permanent solution to leveraged underutilized medical talent to meet labor shortages in high-need areas. Joining the OT Compact will allow military personnel and spouses to more easily maintain their certifications when relocating. We appreciate the opportunity to support the policies outlined in House Bill 540, the OT Compact. Thank you, Delegate Morgan and members of the committee, and I look forward to seeing you again tomorrow.
Thank you very much. Sonia Lawson.
Good afternoon to the committee. My name is Sonia Lawson, and I'm the Vice President for Advocacy for the Maryland Occupational Therapy Association. I'm happy to be here today to support our bill, House Bill 540. Overwhelmingly, the members of our association, the Maryland Occupational Therapy Association, are excited to have this opportunity to have a favorable outcome for House Bill 540, the Interstate Occupational Therapy Compact. Licensure reciprocity is our top priority. It will allow practitioners to meet critical workforce needs and provide services to people from children to older adults that enable them to actually participate in everyday life, doing activities that are most meaningful to them, using restorative and adaptive approaches. We were able to see the benefit and impact of a structured reciprocity system with emergency legislation implemented with the pandemic, and we want to ensure that a systematic process can continue. We want to express our gratitude to Delegate Morgan for sponsoring this bill.
Thank you. Noelle Welch.
Good afternoon, Madam Chair and members of the committee. My name is Noelle Welch. I'm a pediatric occupational therapist. I live and work in Charlotte Hall, Maryland. I'm here today in support of House Bill 540. I would like to thank Delegate Morgan for sponsoring this bill and you for providing me with this opportunity to share why I support the bill. The interstate occupational therapy licensure legislation will be extremely beneficial as it will improve access to OT services across state lines, especially border states. I would like to share two examples from the many that I have personally experienced this past year to demonstrate how this compact would be beneficial. When the pandemic began, I had two siblings who received therapy with my practice relocate to New Jersey to stay with their grandparents. Their mother requested they continue to receive therapy services via telehealth. In order to provide them with continued therapy services, each of their treating therapists had to apply for temporary licensure in New Jersey. We applied for the temporary licenses, and when each therapist received their temporary license, they scheduled the children for therapy. If New Jersey was in the compact, the continuity of care would have been maintained without the lapse waiting for licenses. Another example involves children we see who live in the neighboring state of Virginia. The Virginia state line is only 15 miles from my practice. We have many children who come from Virginia for therapy. Initially, when the pandemic began, Virginia did not allow therapists who were not licensed in Virginia to provide telehealth services to the residents. This caused a lapse in therapy for several clients. Virginia did change their regulations and allowed us to provide services. However, the lapse still occurred. The Interstate Occupational Therapy Licensure Compact will improve consumer access and continuity in care. Thank you for considering this legislation and for your time.
Thank you. I'll now open up for questions from the committee members. Are there questions? Okay, well, I have a question. And I think this is for Ms. Faulkner, probably. I am happy to see a letter of support from the Board of Occupational Therapy Practice. Are they comfortable with, does that mean they're comfortable with all aspects of the compact in terms of how the licensures work and the kinds of follow-up and that has to happen with respect to out-of-state folks who are operating in the compact from other states?
Sure. So thank you for the question. So I don't want to speak for the board, but what I can say is that the association spent probably the entire last half of 2020 talking with the board on an ongoing basis, attending their meetings, having regular dialogue about the compact, and really addressing the questions that they had, including the national stakeholders that developed the compact really did a thorough job in making sure that the concerns that they raised got sufficiently answered. And so at the end of the day, they did come back with support. And so it is our understanding that they are very versed in what the components of the compact are and what it means for the board moving forward.
Thank you. Seeing no other questions from the committee, that concludes the hearing on House Bill 540. And we are now at the time of the day when the committee gets to stretch a bit so we will take a break for 30 minutes and return back at 3:45 for the last 5 bills of the day. So we'll see you back here at 3:45. Thank you. Okay, Melissa, are we ready to go again?
Yep, we're back.
Okay, great. Thank you. Welcome back to the Health and Government Operations Bill hearings. We are going to begin now with House Bill 600, Delegate Belcastro. That's State Board of Examiners for Audiologists, Hearing Aid Dispensers, and Speech Language Pathologists, Duties, Appointment of Members, and Requirements of Licensees. Delegate Belcastro.
Thank you. And yes, it is probably the longest named bill in the legislature this year.
Indeed.
Yes, it has a very long title. Madam Chair, thank you. Members of the Health and Government Operations Committee, thank you for allowing me the opportunity to be before you today. For the record, I am Delegate Lisa Belcastro presenting House Bill 600, and I'll say it again, State Board of Examiners for Audiologists, Hearing Aid Dispensers, Speech and Language Pathologists, Duties, Appointment of Members, and Requirements for Licensees. The State Board of Examiners for Audiologists, Hearing Aid Dispensers, and Speech Language Pathologists has reached that moment in time where it's time to update their statutes. So we've been working with them closely as they've gone through this process. And we believe that this bill will modernize the board while elevating transparency and consistency for licensees. HB 600 seeks to make a number of changes to the board, and those are going to include defining professions licensed by the board as healthcare professionals, specifying how a licensee of the board must represent themselves to the public. And 3, it shifts the responsibility of soliciting board member appointments from local professional organizations to the board itself. And finally, there's going to be some clarifying language and statute regarding licensure requirements. We have a couple of amendments that I want to make you aware of. Amendment number 1 is going to be technical, but amendment number 2, it seeks to remove the mentioning of a balloting process for recommendations of board member appointments. And this is an issue because when the bill was first introduced, the board, or since the bill's been introduced, the board has learned about the significant costs that are associated with conducting a balloting process. So seeing that the board just isn't able to incur those expenses, they would prefer to utilize another means of making recommendations for board seat appointments. So that's the bill. I thank you again for allowing me to present HB 600. We respectfully ask for your favorable report. And with that, I'd like to hand it over to my panel, who has just worked tirelessly with me on getting the details of this bill hammered out.
And thank you very much, Delegate. We'll go to Jennifer Mertis.
Hi, everyone. I'm Dr. Mertis. I am currently the board chair for the Board of Examiners for all the professions in our list. The longest board name ever. This is my 4th year of my term. And over the course of my term, these are items on our bill being proposed. These are items that have popped up repeatedly over time. And so we're taking this as an opportunity to do some housekeeping, if you will. And one really important part I wanted to stress is for consumer protection and making sure that we're able to hold our licensees accountable by putting them in that category of healthcare professional, and also making sure that on all of their work product, they're using their license name rather than some people go by maybe a maiden name or married name, something that doesn't match their license. And that on all of their items, they also indicate their license number. This will help the board with processing complaints and discipline in a more efficient manner and help consumers find information about that licensed professional. I want to thank Delegate Belcastro for his support and everyone for giving us time today. Thank you so much.
Thank you. The next witness is favorable with amendment. So let's see if there are any questions for Dr. Mertis or the sponsor. Any questions? Seeing none, thank you very much. I'll call favorable with amendment Candace Robinson.
Good afternoon, Madam Chair. Thank you, Delegate Belcastro, for sponsoring this bill for us. I'm the Executive Director of the board, and so I just want to say me too I think that Delegate Belcastro touched upon the point very well, and I'm just going to speak to the balloting process and to make sure that it is known that we do follow the proper process of that, where applicants who wish to sit on the board must register or they must apply to be appointed. And once we are given that list of names, we are looking at who we would recommend to move forward to be vetted based upon diversity. And diversity could include race, ethnicity, where they are living geographically on the board, and any subspecialties they represent, so that our consumers and our licensees are well represented by the person that is selected to that seat on the board. And with that, I would like to just say me too to everything else. Thank you.
Great. Thank you very much. Thanks for being here today. Questions from the committee? Delegate Kelly.
Thank you, Madam Chairman, and thank you for bringing this bill forward. I just want to confirm, I think I have it right. You're signed up, Candace, favorable with amendments, but those amendments you're referring to are those amendments that the sponsor already mentioned. It's just one set of amendments, right?
Yes, that is correct.
Great. Thank you so much.
Thank you. Thank you, Delegate. Any other questions? Okay. Seeing none, that concludes the hearing on House Bill 600. And we will move to the next bill, which is House Bill 708, Delegate Krebs. This is the State Board of Dental Examiners, dispositions and summary suspensions, time periods. Delegate Krebs.
Thank you, Madam Chair. House Bill 708 amends our current law regarding disciplinary matters and summary suspensions handled by the Board of Dental Examiners. Our current law does not have any real specific timeline for due process and adjudication of disciplinary matters for licensees. And as you all know, boards have a lot of power over licensees. And if your license is being held up, you can't practice, you can't earn a living. And there's been some concerns over the years about specifically this board. And we want to make sure that the board acts within the appropriate timeline set forth in the bill so that these guys get their answer back as soon as possible. So the need for the bill is to give dentists a fair shake before the board, before they're disciplined. And there's been many instances over the years of the licensees languishing sometimes years without closure on their matters. And that just isn't fair to the licensees. But I'm going to turn this over to my panel, and Danielle Varanian is going to take my time, the rest of my time, and then they can explain how it has affected them. Thank you.
Thank you, Delegate. Ms. Varanian.
Thank you, Madam Chair. Good afternoon, members of the committee. My name is Danielle Varanian, and I'm an attorney at Baxter Baker, Seidel, Kahn & Jones. I represent many healthcare providers, and I appreciate you having me here to testify on House Bill 708 today. This is an important bill that ensures that dentists are afforded the same due process as physicians in disciplinary matters that are before the Maryland State Board of Dental Examiners. Although the Administrative Procedure Act doesn't have an overall deadline in the statute applicable to all health occupations boards, it looks like the dental board is an outlier here in these health occupations boards that is exploiting this loophole. This bill ensures that the Maryland State Board of Dental Examiners issues a decision in a timely manner. It's modeled after the way that Virginia treats board actions under its Administrative Procedure Act. Due process isn't about just having a hearing. It is a meaningful opportunity to be heard. It's not meaningful if you have to wait a year before a decision gets issued. We have seen many instances of the dental board taking many months and even in some cases years to issue a final appealable decision on disciplinary cases. This has an extreme detrimental impact on the lives of these licensees. Imagine if you had an ethics complaint hanging over your head for years. It would destroy your career. I can't imagine having a bar complaint against me pending for months on end either. There's no reason why dentists should be subjected to this. We received the Maryland State Board of Dental Examiners written opposition to this bill. And also I have spoken now with counsel for the dental board, both last night and this morning. We are absolutely willing to work with the dental board on some amendments that would bring clarity to the 90-day time frame and when that time frame would begin to run. However, we want to make certain that there is a statutory framework within which the dental board needs to make these decisions, because at the end of the day, the inconvenience that the board may experience in having to issue a final order within a prescribed time frame doesn't give the board license to violate the due process rights of its dentists. But we can work collaboratively with the board to bring those amendments to fruition. For these reasons, we urge a favorable report on House Bill 708. Thank you.
Thank you. Mr. Barry Lyon?
Yes, hi, can you hear me?
Yes.
Great, thank you. Good afternoon, members of the committee, and thank you for allowing me to testify on House Bill 708. My name is Dr. Barry Lyon. I am a practicing dentist and have been practicing in Maryland for over 40 years. Additionally, I'm a former member of the Maryland State Board of Dental Examiners. I served 2 terms with the board and was also president of the board in 2005. During my time as a member of the board, I had direct involvement in the disciplinary hearings, as was my role as Secretary Treasurer for 2 of the 8 years that I was on the board. And while I served on the board for those 8 years, I cannot recall any extensive lag times between hearings on cases and decisions, final decisions on them. However, 2 years ago, I was an expert on a case before the board. It took about a year for the board to reach a decision after the hearing was held, and it was a total of 7 years since the complaint was originally filed. This wait time was absolute torture for the dentist. His livelihood hung in the balance, as did his career and his reputation. And I can tell you from dealing with many doctors in that situation that it's emotionally agonizing for them until their case is resolved. And it's for this reason that I support House Bill 708, and I urge a favorable report.
Thank you very much, Doctor. Dr. Leonard Badger.
Good afternoon, Madam Chair and members of the committee. My name is Dr. Michael Badger. I've been a practicing dentist for 31 years, as well as an owner dentist of dental offices for over 25. I'm the owner of Lifetime Dental Care, which currently owns 27 practices throughout the state of Maryland, and I actively practice in Lower Maryland. I want to testify today about HB 708 because it's very important to me as a dentist, as well as an owner of dental practices. As the law currently stands, there are no restraints on how long the dental board can take to decide a case against a licensed dentist or hygienist. In situations where a dentist may have been suspended summarily, this leaves a dentist without the ability to earn a living with no assurances about when his or her case may be decided. The dentist could be left in purgatory indefinitely, even if she has resolved all the issues which led to the suspension. You can imagine, like you said, the implications of the continuity of care, the other stakeholders involved with this situation, the credentialing process, as well as those who are employees of the practice and the impact on them. In situations where a dentist may have been suspended summarily, this leaves a dentist without the ability to earn a living with no assurances about when his or her case may be decided. This situation isn't hypothetical. I have colleagues who were prosecuted by the board and in some cases left summarily suspended for nearly a year when that suspension had nothing to do with their case and treatment of patients. That suspension stayed in place even though the officers were there, issues had been resolved, and my colleagues' only connection to the board was they were owners of the practice. Therefore, the General Assembly updated the General Practice Act last year to prevent situations like this from happening, but the legislation didn't resolve the problem of allowing the board to keep licenses suspended indefinitely. Other states don't operate this way. Florida, which is another state which I practice, requires that the board make a decision within a certain period of time. And if it doesn't, then the case gets referred to an administrative judge In most instances, it gets dismissed for failing to afford due process in a timely fashion. The driving purpose of the board is to protect the public and regulate licenses. Keeping the public from access to care doesn't achieve this goal. And licenses shouldn't be deprived of their livelihood indefinitely because of the inefficiencies of the board. I thank you for your time on this matter. And with the best interests of the citizens of the state of Maryland in mind, I urge your favorable report on HB 708.
Good to see you again, Dr. Badger.
Good to see you as well, Delegate Ellison.
That I will now open up for questions from the committee. Delegate Johnson.
Thank you, Madam Chair. And panel, whoever is best equipped to answer this question. Now, does this bill, does it pertain to all disciplinary matters or just those that involve suspensions? Or do all disciplinary matters end up in suspension?
Delegate, I can answer that question. Danielle Varanian again. It does not apply to all disciplinary matters. And it's also not specific to disciplinary matters that involve suspensions. What it does apply to is all disciplinary matters that end up with a hearing. So if a dentist chooses to enter into a consent agreement, for example, with the board, this bill doesn't apply to that. It applies to dentists who choose not to enter into consent agreements and go forward with a hearing. And where the bill starts the clock from running is when that hearing is concluded. That's when the 90-day time frame starts. Does that answer your question, Delegate?
Yes, thank you. And thank you, Madam Chair.
You're welcome, Delegate. Thank you. Any other questions from the committee? Seeing none, we'll move to a panel of unfavorables. And we have Arpana Verma.
Thank you, Madam Chair. Good afternoon, committee members. Thank you for the opportunity to testify on this bill today. My name is Arpana Verma. I'm a practicing dentist, and I'm also a member of the Maryland State Dental Board. I'm extremely concerned with the unclear language of this bill. A license is summarily suspended only after a thorough investigation and in serious cases of public health, like infection control violations, substance abuse, or assault. Getting a response to subpoenas in a timely manner, verifying and examining all that information can take 30 to 60 days alone, and that's with a cooperative defendant. Most dental practices don't have electronic health records like medicine does, and records frequently include things like models and physical x-rays that have to be delivered by mail. If the respondent delays, whether intentionally or unintentionally, this timeline is further delayed as courts take 4 to 8 weeks to enforce subpoenas. The board meets twice every month, so scheduling conferences and hearings with attorneys, et cetera, logistically can take another 4 weeks. This does not account for negotiations, board deliberation, and certainly review by the Office of Administrative Hearings, which is very important. The Board of Physicians takes approximately 18 months to complete a case with over 10 attorneys and 20 compliance staff, while the dental board has access to 2 part-time attorneys and 3 compliance staff. While we're all working very hard, and when a board issues a summary suspension, it is certainly prepared to move forward with its case. The respondent, however, has to take corrective measures. Lifting the summary suspension includes doing a physical re-inspection of the dental practice to ensure patient safety. Therefore, by the next scheduled board meeting, the dentist may not have had enough time to prepare, and there's no opportunity to ask for a continuance. A 30-day period to correct violations, prepare for a hearing, and have the board conduct that hearing and issue a final order will prove very insufficient and allow respondents who are a serious public health threat to get away with it. Rushing the due process rights of the respondent to get a decision out helps no one, especially the safety of the citizens of Maryland. All this said, there is room for improvement, and we are happy to open discussions and regulations to improve the process if allowed. Therefore, we respectfully request an unfavorable report on House Bill 708. Thank you so much.
Thank you, Doctor. Leslie Grant?
After several emails, Ms. Grant is not with us today.
Not with us. Okay. Then I will open us up to questions from the committee. Are there questions? Okay, seeing none from the committee, I have a question, Dr. Verma. So it seems to me that there are 2 time periods that we're talking about. One is prior to the hearing and one is after the hearing. So
Yeah.
Can you speak to what the need is and how in each of those 2 windows?
Certainly, and thank you for the question. Dr. Grant was planning to address that in her testimony, but apparently she's having some connection problems. The board schedules a hearing at the very next available board meeting. We meet twice a month, which is more than any other board. And so the timeline that we're looking at is that the board can schedule it at the very next board meeting. However, at many times there are conflicts with defense counsel or other issues that need to be addressed. So let's say that the hearing actually took place within the time frame. After that is actually out of the board's hands. That final decision, the board typically votes either that day or very soon after, but that decision then has to go to the Attorney General's office to submit a final consent order or a final decision paper. Those decision papers have to be reviewed by the Office of Administrative Hearings to ensure non-competitive action. And that can typically take 90 days alone. And that is typically how they handle the issue. So unfortunately, we don't have control over the AG's office, and they can sometimes take a considerable time to get us a final consent order.
Thank you. Now I see some questions. Delegate Krebs.
Well, thank you. And thank you for explaining that process. We had this bill last year, and it actually happened at the end of COVID. I mean, at the beginning of COVID, and we didn't have time to really do anything, but it was in the Judiciary Committee, which is not really where it belonged. So that, I guess the issue came up last year. And has anything been done this year to improve the process? You said that you think there's some opportunity for improving the process. And Attorney General's office, you said, is maybe part of the problem. But it seems to be a problem more with this board than others. And I'm trying to fine tune, what is the problem, where it is. Can you explain a little bit more how we can improve the process, and should we be in touch with the Attorney General's office?
Thank you, Delegate Krebs, for that question. That's actually an excellent question, and one that we have been asking as well at the dental board. We do our best. Almost every single member of the dental board is a practicing licensee. And so this is, like for many of you, our second job. And we are trying to keep many balls in the air at the same time. In addition to that, trying to have, like I said, these hearings where everybody can attend and defense counsel can be present is a problem. The other issue is that we don't really have any control. Once it goes to the Attorney General's office, they have multiple layers there that it has to pass through, none of which are reported to us. We do follow up on a regular basis. Our compliance department is active in doing that. We've had a chief dental officer in place for the last year. It took us 2 years to hire one. Staffing is also an issue that we are consistently struggling with. In order to ensure that. I, as a board member, spend at least 40 hours outside my regular job doing board work, trying to follow up on multiple issues. Yes, I believe that there are opportunities to improve the process and smooth it out. And I think the Attorney General's office would need to come in to answer what the delays are on their end as well.
Thank you. Maybe we can do that in subcommittee. Thank you for your volunteering for the board. But in the meantime, these guys aren't getting paid while they're being suspended. So I hope we can get to the bottom of this. But thank you so much for your service.
Thank you.
Thank you, Delegate. Delegate Johnson.
Thank you, Madam Chair. Can you tell us, do you have any idea on average how long it takes to resolve a case when there's a suspension involved?
Certainly, I'll try to walk you through the process. So typically when a complaint is received at the board, and especially if it's an egregious issue, typically it's handled almost immediately. It's triaged and then sent out. For example, I'll use an infection control guideline case as an example. So let's say we receive a complaint that there is unsanitary practice and disease transmission at an office. An inspector is sent out quite rapidly. That report typically turns around within 10 to 14 days, at which point the board's biosafety committee would handle that and bring it to an emergency board vote. Once that's done, the licensee is summarily suspended. The board statute requires us to have a hearing on that almost at the very next board meeting. However, frequently many licensees will not take advantage of that because they are in the process of corrective measures. So typically there's a 2-week or 30-day lag by the time that we can have a hearing on that. There is an opportunity for that, and that is always available. Board counsel is very responsive to that. Once that is completed, and typically at that point, the licensee will enter into some type of negotiation in order to lift their summary suspension. And that is usually held at a case resolution conference that's usually held at the very next board meeting. So if you're asking me for an average time, the fastest turnaround time that we can have on this is usually typically 30 days.
Now, does that include the timeline at the Attorney General's office? I'm asking overall, with all the parties involved, what typically is a timeline to get an issue resolved?
That's a great question. I can't answer that completely because we have been asking for a report from the Attorney General's office for many months now on where the progress is on multiple of our cases, and we have been unable to have them respond to that. So it's not for us lack of trying on where our cases are, but if we're talking about the summary suspension cases, those turn around very quickly. The disciplinary action cases typically take longer and could be 6 months by the time the Attorney General's office gets back to us with the final consent order. And that's despite the fact that the board has held a hearing within 30 to 60 days.
All right, thank you. Thank you, Madam Chair.
You're welcome, Delegate. Any other questions from the committee? Okay, seeing no further questions, that completes the hearing on House Bill 708. Thank you very much for your time and testimony today. We will move to House Bill 1030. Delegate Saab, State Board of Dental Examiners, Membership, Nomination, and Appointment Process. Delegate Saab.
Thank you, Madam Chairman. Just want to make sure that you actually could hear me because I know you had issues with Delegate Morgan earlier.
We can hear you.
Fantastic. Well, thank you. Good afternoon, Madam Chairman, members of the committee. For the record, my name is Delegate Sid Saab, here to present to you House Bill 1030. This bill was introduced in 2019 before you as House Bill 807 and was put towards a summer study conducted by the Department of Health as an alternative to legislation. However, the Department of Health did not address the governance of the dental board, but instead discovered other issues that did not address the intent of the bill. House Bill 1030, State Board of Dental Examiner Membership, seeks to change the nomination and election process for the State Board of Dental Examiners. Currently, the board process requires solicitation of nominations from licensees and a balloting process. This process creates inequity in the outcome of the licenses that are ultimately gathered and submitted to the governor. House Bill 1030 would instead require the governor to appoint licensed dentists and dental hygienists from a specific list, as numerous other health occupations board currently required to fulfill the vacancies. The current solicitation process used by the board makes it difficult for qualified licensees who may or may not be the most successful in soliciting votes from their fellow licensees, but would nonetheless be competent members of the Board of Dental Examiners. Similarly, back in 2003, the nomination of the Board of Physicians were conducted in the same manner by the State Medical Society. And because of numerous problems with the balloting process the State Medical Society was conducting, the General Assembly, in its wisdom, sought to change the process, and they did so in 2003, which this bill pretty much mirrors the same exact process that's being done by the Physicians Board. So I urge the committee for a favor report on House Bill 1030. And Madam Chairman, if you'd allow me to yield the rest of my time to my panel, I would greatly appreciate it.
Absolutely. Delegate, do you have someone whom you specifically want to follow you, or should I just call in order?
You can just call in the order you wish. Thank you.
Okay, then we'll go with, I think it's probably Dr. Joyce Thomas.
Madam Chair, Dr. Thomas is telling me that she's still in the waiting room of the Zoom.
Okay. Melissa, can we get?
No, I let her in. She should be in.
Do you see her?
She should be in the room.
Okay. Dr. Thomas, do you have your mute on perhaps? Okay. We're going to go with Dr. Lyon, and then we'll come back to Dr. Thomas. Okay, so Dr. Lyon.
Thank you. Members of the committee, my name is Dr. Barry Lyon, and I've been a practicing dentist in Maryland for over 40 years. I'm here to testify today about Bill 1030 because I think it's important to have a fair and equitable process to become a member of the State Board of Dental Examiners. In 2000, I was elected to the State Board of Dental Examiners, and I served 2 terms from 2000 to 2008. In the year I was elected, I was not the highest vote recipient, yet I was elected to the board. Now, this bill would ensure complete transparency to the governor. All dentists wishing to be appointed, and hygienists and consumer members as well, should be evaluated and appointed by the governor. This bill takes away the election process altogether. It's important that the members of the Maryland State Board of Dental Examiners be appointed in a fair and transparent manner, and this bill will do that. And for these reasons, we request a favorable report. Thank you.
Thank you, Doctor. Dr. Thomas, are you in the room now? Dr. Thomas? Okay, let's go to Ms. Varanian again.
Sorry, she just texted me to let me know that she's still not showing us in the room. I'm sorry for the technical issues.
Madam Chair, may I ask a question of Melissa? That sometimes we
Melissa?
the
Sure.
name, she may not be showing her name correctly, so maybe she can, whoever
She's
just.
showing us in the room for me. I'm gonna resend her the link, so I think she should get out and get back in.
Okay.
Okay, I'll tell her that.
Okay, great. And in the meantime, okay. We have to be flexible with the technology that we're all getting very used to, but still it presents us with a hiccup now and then.
Okay. I told her that you'll resend the link to her and that she should go out and come back in.
Yeah. Okay, well, why don't you go ahead, Ms. Varanian.
Thank you. Thank you, Madam Chair. Good afternoon, members of the committee. Again, my name is Danielle Varanian, and I'm an attorney with Baxter Baker, Seidel, Kahn, and Jones. I'm here to testify on House Bill 1030 and urge a favorable report on this bill. No other health occupations board has an election process like the one used to elect the members of the dental board. This bill is simply modeled after the way the Board of Physicians appoints its own members. For far too long, the dental board has controlled who gets appointed to its board. And in fact, the board not only runs the entire election process from soliciting the nominations, weeding out the candidates, and running the election itself, but it also then determines which candidates to send up to the governor's appointment office. If you're the top vote getter, you get on the board, right? No, it doesn't matter if you were first or last or somewhere in between. The board may submit your name and it may not. It's a mystery. What isn't a mystery is that this leads to a board with members appointed due to popularity and who the current board likes rather than by merit. We hope that you get to hear from Dr. Thomas. Dr. Thomas is a dentist who has practiced for over 20 years and has great respect and support from her peers. But despite this, she isn't on the board, despite having run for the board in 2018 and was the second highest vote getter. Her name wasn't even submitted to the governor. We're asking for a favorable report on this bill to ensure that the dental board members are appointed like all other health occupations board members, including the members of the Board of Physicians. And again, just to be clear, we did an exhaustive search of all of those health occupations boards, and this dental board is the only one that has a process like this. Again, members of the committee, we urge a favorable report on House Bill 1030. Thank you.
Thank you. Dr. Thomas, are you here yet?
You should be in the room.
Okay.
She needs to unmute herself.
Okay, Dr. Thomas, please unmute. Okay. Did we get it?
She's here. She just needs to unmute herself.
Dr. Thomas, if you see the unmute microphone on your screen, usually on the bottom or the top of your screen.
I apologize, members. She's saying that she can't see or hear anything. She's just having some sort of technical issue.
I'm sorry. If she's able to get in or show up before the end of this hearing, we'll certainly allow her to speak. But let's go to Dr. Justin Ambrose.
Members of the committee, my name is Justin Ellis Ambrose, and I've been a registered dental hygienist for almost 6 years in the state of Maryland. I'd like to first thank you for the opportunity to testify on this important bill. Please forgive me for my appearance as I'm currently providing dental hygiene services. However, I felt taking time today away to testify on this bill is very important to help protect the safety and well-being of all Maryland residents. Of the 16 members that currently make up the dental board, in the state of Maryland, only 4 members are dental hygienists. Because appointment to the dental board is an election process where hygienists are nominated by and then voted on for by other fellow hygienists, appointments to the board becomes more of a popularity contest. Whichever hygienist knows the most hygienists gets the most votes. There's no consideration of experience, training, or real-world qualifications. It seems the Maryland Dental Hygienist Association endorsed candidates are always the candidates that win and get elected, which is historically evident based on the past election results, especially in this past year's election, many of which are not actively participating or practicing in a clinical setting. Having all Maryland Dental Hygienist Association endorsed candidates went forth to a very one-dimensional board lacking in diversity. The goal in having a dental board is to protect the public. The patients that I treat are the most vulnerable and underserved populations in Maryland, Baltimore City children receiving Medicaid. The board should have a voice for the underserved and most vulnerable populations of Maryland because more times than not, these patients do not always have the necessary resources to have a voice of their own. With an appointment process like the one Bill 1030 proposes, each nominee has an equal opportunity to be appointed to the board without having to worry about getting his or her name recognized. This will allow qualifications rather than a popularity to be the main consideration in becoming a member of the Maryland State Board of Dental Examiners. This bill will also protect the integrity of Maryland State Board of Dental Examiners' mission to protect the citizens of Maryland and to promote quality health care in the field of dentistry by making the board more diversified and removing the possibility of outside agency and association influence who may have their own biases, goals, agendas in mind. We ask that you issue a favorable report for Bill.
Thank you very much. Dr. Thomas, I think that you're here. We can't hear video, but we can hear you in the background. Are you there?
So members of the committee, I asked Dr. Thomas if she could call me on my cell phone so she can speak her testimony. Is that acceptable?
We'll allow that. Just make sure that we can hear it. Okay.
Thank you. Dr. Thomas, are you there?
Yes, I'm here. Can you hear me?
Yes.
Okay.
Yes.
Go. Okay. I'm so truly apologize for the technical difficulties. I had difficulty getting into my computer. I could see my name, but I couldn't get it to unmute or get the camera to show up. Thank you for allowing me to be here today. My name is Dr. Joyce Thomas. I've been a dentist for almost 23 years. I'm here to testify on behalf of Bill 1030 because I have been personally affected by the process of dental board elections. In 2018, I was nominated to run to be a member of the dental board. I took that nomination very seriously and with pride. My colleagues voted for me. I was actually the second highest vote recipient in the 2018 election. Despite this, my name was not even submitted to the governor to be considered. This bill removes the election process as well as the control of the dental board in determining which candidates' names are submitted to the governor. Licensees who are willing to give up their personal time and mental energy to devote service as a member on the board should all be fairly considered for their qualifications. The dental board should not be allowed to cherry pick its members. As I sit here today, I am not a member of the dental board. For these reasons, we hope that you issue a favorable report on this bill.
Thank you, Dr. Thomas. Dr. Thomas, stay on the line in the event that there is a question from the committee for you. And I am now opening it up to questions from the committee. Okay. All right. I see no questions for this panel. Delegate Krebs.
Sorry about, I wasn't quick enough on the draw there. I just want to ask Ms. Thomas, can you explain how in 2018, who got nominated and where were they in this process? Just finish explaining how the person got chosen.
So when a doctor is interested in running for the board, they are officially nominated by another doctor. And then you submit paperwork supporting that nomination, multiple signatures from other doctors, about, I believe, somewhere between 15 to 20 different doctors sign in support of your nomination. And then you receive notification from the board explaining that your nomination form was received, your CV was received, and at that point, they will enter your name onto the ballot. And then once it's on the ballot, then when the election opens up, the dentists, licensed Maryland dentists, can vote on the doctors that are on the ballot. And then once the votes are completed, once the voting period is done, then names are submitted to the governor for consideration, and the final appointment is done by the governor. But not every name that is on the ballot is submitted to the governor. So even though I was on the ballot, and even though I received the second highest number of votes, my name was never put before the governor to consider for an appointment.
Was someone, one other question follow, was someone after you put on the, given to the governor, a name after you in the running was submitted to the governor? Is that the implication? Somebody?
Oh, I don't know. I do not remember all the names of all the various doctors that were on the ballot that year, but my name was not even submitted. So it just, the confusion about this is, if there's an election process, it's not clear and it's not fair, and it takes the control away from the doctors. If we're asked to vote for a colleague, why is that name not even considered?
Okay, thank you.
Thank you, Dr. Krebs. Delegate Bandari.
Thank you, Madam Chair. I'm wondering if we do have an opposition panel, anybody from the board?
We do, not from the board.
Yeah, then if that is the case, I would ask this question to Dr. Thomas. I'm really sorry that you wanted to serve on the board, giving your personal time and mental energy, and they cherry picked. What do you think was the whole intention of the elections if they are not going to submit the name who gets the highest vote getters? Did you know the process before?
I understood that they would be a nomination, and that then there's an election, and that the final appointment is made by the governor. But I was never notified as to why I did not even receive consideration once I went through that process. It seems to have been a moot point to go through the process of the nominations and the election, and then have no feedback whatsoever, at least to have been told you were not chosen, or you were not chosen for this reason, or this other person was chosen. It was almost like an exercise in futility. And that certainly is not how I intended. That was not my purpose in running for the board.
Thank you.
Thank you, Delegate. Delegate Lewis.
Thank you, Madam Chair. Thank you to the bill sponsor and the panelists. My question is this, whoever's best positioned to answer. I've served on a lot of nonprofit boards, and all nonprofit boards must have bylaws or, the rules of engagement that describe everything from elections to qualifications to serve to meeting schedules and all of that. And I guess I'm just curious, does the Board of Examiners have bylaws? Is that something that is required in an entity like that?
Delegate Lewis, this is Danielle Varanian. I can answer your question partially. I'm unaware of whether the board has bylaws, but there are extensive statutory requirements under the board statute for how board members are supposed to be elected, how that election is supposed to be conducted, how many names are supposed to be submitted to the governor for the appointment process after the election. The mystery here is about how those names actually get submitted, what names actually get submitted. And the other part that this bill addresses is the fact that this board is an outlier in that it has an election process at all. So to answer your question, irrespective of whether there are bylaws or not that govern the Maryland State Board of Dental Examiners, there is significant statutory constructs that are supposed to govern this election process. And many of the other health occupations boards have statutes that govern their appointment processes as well.
And do you think other similar entities have better appointment processes? Are you saying that dental board should come in alignment with its peer groups? Okay.
Absolutely, Delegate. Absolutely. We believe that the dental board's appointment process should be akin to the appointment process of the Board of Physicians and many of the other health occupations boards, that it is a true appointment process controlled by the governor.
Great. Thank you for clarifying. Thank you, Madam Chair.
Oh, you're welcome, Delegate. Delegate Hill.
Thank you, Madam Chair. Thank you all for being here today. If the dental hygienist is still on, I think that was Mr. Doring, maybe? No, that's Dr. Doring, is it?
Yeah, Mr. Ambrose.
Mr. Ambrose, okay. So Dr. Thomas just testified that she was surprised that she got the most votes and her name did not go up. You made the point that you want to be sure that the process is not a popularity contest, so that even someone who doesn't get top votes, if they have other qualifications, that they get a good look and that their name goes forward. I just want to make sure I have that clear. And you think that going to the same kind of process the other board use would take care of both your concern that the qualities be looked at and her concern that the person with the top votes be on the list.
Yes, this bill 1030 is multi-dimensional, and there's getting names submitted to the board is very important, especially when you're voted on amongst your peers. Win that second seat, your name's not even being submitted for recognition or for them to appoint you to that board seat. So going forward with Bill 1030 will ensure not only that it's not just about popularity, but it's also about qualifications and your work history and your true intentions on being on that board seat.
All right, thank you.
Thank you, Delegate. Seeing no other questions from the committee, we'll move to an unfavorable panel. Begin with Dan Doherty.
There we go.
There we go.
Can you hear me?
We can, Dan.
Okay, thank you. Thank you, Madam Chair, members of the committee. My name is Dan Doherty, and I'm representing the Maryland State Dental Association in opposition to House Bill 1030. And I must tell you, the history of where we are today was a long process. It used to be that the names were submitted after a joint meeting of the Maryland Dental Society and the Maryland State Dental Association. This General Assembly changed that a number of years ago to authorize that the names that are submitted for consideration by all licensed dentists come from nominees of any state dental organization that has a national affiliation and by a petition signed by 15 dentists. This opened up the opportunity for a lot of people to be nominated. The process, as I understand it, and it includes the 2018 process, all the names that were subject to vote by licensed dentists, whether they received the most or none, all names went to the governor. And in fact, it's my understanding Dr. Thomas's name went up and she was the third person in terms of number of votes. Secondly, this is probably the most open process of all the boards. For example, the Board of Physical Therapy nominations to the governor come solely from the Physical Therapy Association. No petitions, no other organization. Same is true of podiatry. In the statute, the physician board is got 22 members and 11 of those slots are designated for certain specialties or in education. And it's those associations that submit the names to the governor. So there is control of the physician organizations totally. That is not true here. And we would submit that the current process is fair and we would urge an unfavorable report.
Thank you, Dan. Dr. Charles Doring.
Hi, thank you, Madam Chair, members of the committee. I'll take the handoff from Dan in opposing House Bill 1030. I just want to clarify, I have a letter from the state board to the governor dated December 15th, 2020. On this is the list of the 4 dentists and 5 dental hygienists that were nominated through the process to the governor. This includes Dr. Thomas and Mr. Justin Tyler Ellis Ambrose. They are on the list. Yes, there is voting on that, but I would say that doesn't weigh that heavily with the governor. The governor is looking for diversity. If this bill goes through, it's going to hinder diversity. And let me explain why. Say, for example, and this wouldn't happen under my watch, but say the Maryland State Dental Association said, hey, let's put 10 nominees up for the board. This bill doesn't limit it. Currently, we can only do 1. And also other associations like the Maryland Dental, Hispanic Dental Society can nominate 1. Academy of General Dentistry can only nominate 1. The Maryland Dental Society, who represents people of color, can only nominate 1. And then, of course, if, as Dr. Thomas was saying, an individual gets signatures, they can also petition. So we do feel that that's very fair, and it gives the dentist at least a little bit of input. And if I could just tell you a little, this is my second Zoom today, about 3. I was asked to be on a committee for dental students to get 2 scholarships. And I had to go over 30. And I submitted 5 names to the dean of our dental school. And I was really honored to be part of that. And so at least hearing a voice of other members, other licensees is very, very important. So I asked for an unfavorable report on House Bill 1030. Thank you.
Thank you, Doctor. Questions from the committee. We'll begin with Delegate Johnson.
Thank you, Madam Chair. And this question is for Mr. Doring. Mr. Doring, you spoke about diversity on the board. Can you give us a rundown of how many members there are and the diversity as far as women on the board and minorities, if you would, please?
I I don't have that data in front of me. I can get you that
Is there
for
anyone
the
on this
committee if you would like.
Is there anyone on this panel that can answer that question?
We'll get it, Delegate, and make sure that
Well,
we get it before subcommittee.
The beginning of the bill, there are 9 dentists, 4 hygienists. Those are all appointed by the governor. They do a 4-year term. And then they're also approved by the Senate. And then there's 3 consumer members appointed by the board. I can give the committee a rundown on diversity, but I'd have to go through the full list of membership, and I may not, based on names, be that familiar, but I'd be happy to get that information. I know the governor works for diversity in ethnicity and also specialty. It's important for the board to have information, say on a case dealing with oral surgery or endodontics, root canals, or periodontics. So they also look for diversity in that way. So not being selected is not a bad thing. And I really encourage as many people as possible. But sometimes there's a shortage, say, in pediatric dentistry, and the board needs that expertise. So the governor may take that recommendation. But I would say the board is not in charge of who's nominated. It's just the process, but it's ultimately the governor's decision.
Thank you, Mr. Gordon. If you could get us that information, well, we'd appreciate it. Thank you, Madam Chair.
Thank you. Delegate Bhandari.
Yeah, thank you, Madam Chair. Listening the witnesses, it seems to me that the board is kind of unregulated. And this question is to Dr. Daniel Dorothy. You claim that the current process is most transparent process. But listening to Dr. Thomas' case, I think your commitment, confidence, and character of the election process is in question. So would you mind sending your bylaws with the case why Dr. Thomas was not selected? I would like to know what went wrong, whether her qualification or something. When we run the election with somebody wins the elections, why she was not picked. So could you comment on that? You said that
well,
the most transparent, but it does not look like most transparent.
Delegate, I'm not on the board. I'm the lobbyist for the State Dental Association. So I don't have any information about bylaws. There are regulations that have been promulgated that expand on the nomination process. And in essence, for every vacancy, a state association affiliated with the national may make a nomination. And any licensed dentist may get the signatures of 15 other dentists to nominate them. And all of those names are then sent out for a balloting process of every licensed dentist in Maryland. And then those votes are tabulated and a list is compiled and it goes to the governor. There's no decision on who goes on the list by the board. It used to be years ago that the dental associations controlled all the names that went up. There wasn't a ability for a dentist to petition. So all of that has been changed. Many of these other health occupation boards, however, when you look at the statute, it says the governor will consider nominations submitted by, and in some cases, it's the American Physical Therapy Association or it's the Podiatric Medical Association. And there aren't petitions and there aren't these other sources. So in dentistry, more names can be considered by the general, all licensed dentists voted on, and those names go to the governor. It is much more expansive than many of the other health occupation boards.
Thank you.
Delegate Krebs.
Thank you, Madam Chair. And either Dr. Lyons or Danielle can answer this question. I'm still a little confused. I'm comparing the other boards, how they do the process, and the dental board, and how the governor office has to select from this list. How do they then ensure diversity, geographic diversity, and all these other things that have been considered? How is that possible to do when they're working from a list? Or do they have to work from this list? I'm still a little confused.
Delegate Krebs, oh. Sorry,
Either one.
Delegate Krebs, I was going to say, I can hopefully answer your question.
Well, wait a minute. This question's for this panel, so we have to go with either
I'm sorry. I'm
Mr.
sorry.
Gardy or
My mistake. Maybe Dan. Sorry.
right.
It's my understanding, Delegate Krebs, that like all nominations, the governor interviews at his or her discretion the nominees, and based on those interviews and other information that may be submitted, makes his or her decision.
But does it come from this list? Does it always come from the list?
Yes, although my understanding has been in recent years, because of a lot of controversy, everybody on the list ended up going to the governor. And in fact, there are times, and our board is not unique, where it's difficult to get people who want to run, so you have a sufficient number of names to give the governor. In some cases, you need 4 names if there's 1 vacancy. Well, you may not be able to get 4 people that want to take on that responsibility at that point in time.
Thank you.
Okay, thank you. Delegate Saab.
Thank you, Madam Chairman. So, Dr. Thomas, I was a little confused. So I understand that you were second vote getter in 2018.
Okay, Delegate Saab, that was the previous panel.
Okay, well, I mean, they can answer the question. They can answer the question. I was talking about Dr. Thomas. So she was nominated in 2018. Was her name submitted then?
I think Dr. Doring has the list, but it's my understanding that her name did go up. She was the 3rd in terms of votes, and she was on the list that went to the governor.
For 2020. If I could clarify, I've been in touch with Frank McLaughlin, Executive Director of the board, and he was not in that position at that time, but he's going to look that information up. But it's always been the standard that everyone that's up for nomination is on the list. And I would say the governor could even go off the list if there's someone the governor really feels needs to fill in a deficiency.
Well, I can actually answer the question for you. Her name was not submitted in 2018, and she was the 2nd vote getter. So I just want the committee to know. Thank you, Madam Chairman.
Thank you, Delegate. Delegate Kelly.
Oh, thank you, Madam Chair. I think Delegate Saab really got at my question. So I'm just going to repeat it so I make sure I understand it, because it is my understanding that this issue we're talking about was the 2018 year, and that Dr. Thomas's name wasn't submitted then. So it's good to see that in 2020 that challenge has been rectified, but I think the legislation was put in to address the problem that occurred in 2020. So we're definitely going to need some clarity on that, I think. So I guess that was a question to Dr. Doring, because since you brought up the letter, the question is, can you work with us to make sure we understand what actually happened in 2018 and how we can make sure that that doesn't happen and we have a better process?
Good question. Dr. Doring, you want to respond?
Mr. McLaughlin, he's on the other line. He's getting me that list. He's going to have to do some research. Like I said, that's from 2 years ago. The letter he sent me dated in December contained everyone that was on the ballot. So all the names, like I said, there's 4 dentists and 5 hygienists. And I believe the slots were only for 1 dentist available and 2 hygienists. But I will get that for Delegate Pellison, and she can disperse that to the committee. It may take me 24 hours.
Thank you, Carly. I'm trying to think. I would ask that if we could just have some clarity around, is it consistent, and you don't have to answer now, but is it consistently that all of the names go forward and have always gone forward, or is it after 2018 some changes were made? So you'll be able to find that out for us. Seeing no other questions from the committee, that completes the hearing on House Bill 1030, and we will go to House Bill 758, Delegate Bagnall, and that's Maryland Licensure of Certified Midwives Act.
Good afternoon, Chair, Vice Chair, and members of the committee. For the record, I'm Delegate Heather Bagnall, testifying on behalf of HB 758, Maryland Licensure of Certified Midwives Act. You have my written testimony, so I'll summarize. I'll start by saying that this is that rare bill which is supported by the nurses, the Hospital Association, physicians, and the American College of Obstetricians and Gynecologists to address a priority not only of this committee, but of the Women's Caucus as well: broader access for maternal care and better outcomes in infant and maternal mortality. Midwifery is an important part of continuity of care and consumer choice because midwifery emphasizes women-centered care that prioritizes the woman's unique individual needs as defined by the woman herself. In other words, midwives meet women where they are. According to recent studies, Black women have a 3 to 4 times higher risk of dying from pregnancy complications than white women, and non-Hispanic Black women are at higher risk for preterm labor, preeclampsia, hypertensive disorders of pregnancy, infection, and other complications. This morning at our Women's Caucus, we heard about the alarming rise in infant mortality rates in our rural communities in Western Maryland and on the Eastern Shore. The addition of a licensure for certified midwives would expand the workforce available to communities across the state of Maryland and streamline the process for midwives whose early education was not in nursing. Maryland already recognizes certified nurse midwives, or CNMs, and certified professional midwives. The only difference between CMs and CNMs is that they have a different college degree prior to entering the midwifery program. Both are identical in graduate program education, exams, certifying entity, scope of practice, and settings. Licensure for certified midwives would expand the number of midwives in Maryland, create a more streamlined and cost-effective process for those who have completed a qualifying undergraduate program but do not have the time or resources to return for a nursing degree, and would also free up slots in the nursing programs for those who wish to pursue nursing long-term. This bill will help expand access for the next generation of providers to provide for our next generation. With that, I will turn my time over to my panelist, Melissa Fleming, and I ask for your favorable report.
Thank you.
Thank you.
Okay. Ms. Fleming?
Thank you. Good afternoon, everyone. My name is Melissa Fleming. I'm the president of the Maryland affiliate of the American College of Nurse Midwives, and we're privileged and so happy to urge the committee to support House Bill 758. And thank you, Delegate Bagnall. She said so much of what is in my heart and mind to say today. As midwives, we are dedicated to being with women. That is our purpose. That is our cause. And we're dedicated to it because we find that having competent and caring midwifery care allows women autonomy in their health care. And we know that it provides them better health outcomes for them and their babies. By supporting this bill, you will support women in Maryland to have more options when they choose their maternal health care provider, and encourage skilled certified midwife providers to live and serve in Maryland. Our affiliate desired certified midwives to be privileged to offer our colleagues the opportunity to live and work with us here in the state, and thereby increase our workforce and the diversity in our workforce. Enough studies, quantitative and qualitative, have shown that when patients get to choose a provider that they feel comfortable with, that they have better outcomes. And this is also especially found when they have providers that share the same ethnic background as they do. In 2019, according to the American Midwifery Certification Board, only about 6% of midwives right now are identify as Black or BIPOC. In comparison, in the total nurse workforce, there's about 9.9% of them who are African-American or Black. While both the numbers are increasing, the disparity in nursing produces a blockage in the growth of midwifery's diversity. The pathway to CM allows an opportunity for women of color, or more women of color, to enter the midwifery workforce and therefore be available to women who want to seek out their services. Once again, leading to better health outcomes for Maryland mothers and babies. So we urge you to give a favorable report on House Bill 758, and I thank you so much for your time.
Thank you very much, Ms. Fleming. We'll go to Ashley Black.
Can you hear me?
Yes.
All right. Good afternoon, Chair, Vice Chair, members of the committee. My name is Ashley Black, and I'm the lead attorney for the Health Rights Project at the Public Justice Center. However, today I am here testifying on behalf of the Reproductive Health Equity Alliance of Maryland, of which I'm a co-chair. You have our written testimony. REAM is a coalition of doulas, community health workers, other birth workers, and advocates seeking to expand access to quality maternal health care in Maryland and eliminate racial disparities in birth outcomes. We stand in strong support of House Bill 758 as a vehicle to expanding the practice of midwifery in Maryland. Pregnant individuals are facing unseen challenges and a different landscape for birthing during the pandemic. We need to ensure that families have access to all options for assembling their birthing team, especially those options that are patient-centered like midwifery. Certified midwives are one of the many keys that our state can benefit from in the fight to reduce infant and maternal mortality and other birth disparities. This bill would require the State Board of Nursing to develop standards and oversight for the practice of certified midwifery, which would help ensure that Marylanders know what to expect when they receive care from a certified midwife. It would also help us increase the presence of this practice in Maryland, making sure that there are enough certified midwives to support the individuals and families who need them. Thank you for hearing this bill and for hearing my testimony, and we urge this committee to issue a favorable report. Thank you.
Thank you, Ms. Black. Robin Elliott.
Good afternoon, Robin Elliott, representing the American College of Nurse Midwives, the Maryland affiliate. I'm really just here to answer questions about the draft. I will mention that the Board of Nursing is in support. They submitted amendments, which we consider technical amendments, and we'd be happy to work with the bill sponsor and the committee on forwarding the board's amendments. Thank you.
Great, thank you. Ms. Jan Krebs, please.
Yes, thank you, Madam Chair and committee members for the opportunity to testify. My name is Jan Krebs. I am the legislative chair for the Maryland affiliate of ACNM. And probably the question I get most often is, another midwife title? Well, among midwives who follow the certification path that Melissa and I did through the American Midwifery Certification Board, the reason there are two titles is really simple. Most of us have a baccalaureate degree and a nursing degree. Some of us have a baccalaureate degree and took our prerequisite courses in the biological sciences, social sciences, and physical sciences as individual classes rather than as part of a different professional degree. Once a student enters a program leading to certification by AMCB, there is no difference. All of our students take the same classes, they have the same clinical expectations, they have the same competencies they have to meet to graduate, and they pass the exact same board exam. So there is no educational difference. Our profession mandates a single standard for all of our new graduates. So we do ask for a favorable report and the option to offer midwives who are CMs the right to practice in Maryland. And thank you for your consideration. I'm happy to answer any questions.
Thank you very much, Ms. Krebs. Okay, I think that's everyone. So I will open it up to questions from the committee and Delegate Kelly.
Hi, thanks so much. It's just a really quick question. I've been reading through the materials and I haven't seen the answer, but I'm sure it's in there somewhere. But can anyone answer how many CMs we might be talking about in the first few years? Just the, is it a handful?
In the first few years, it's a handful, simply because if CMs aren't licensable in this area, they're not going to gravitate to move here. I know of 4 CMs in the DC, Northern Virginia area. Virginia is also looking at licensing CMs this year. So it may be a case of who gets to them first. We have a program in Philadelphia that educates CMs, and that's an easy reach for students in that program to come down this way to practice. Ideally, we will add certified midwives in at least 3 states this year. The more states we add, the more attractive it is to students, and we can move along. But
no, that's very helpful. I just really wanted a sense of the scope. I think it's wonderful. We could potentially create an alternate path for people to enter to go into midwifery. I love it. Thank you.
Seeing no other questions from the committee, that completes the work on the hearing. There's work to be done, but the hearing on HB 758. Thank you, Delegate, for bringing us the bill. And we will move to our final bill of the day, which is House Bill 604, Delegate Kipke, Funeral Establishments and Crematoriums, Unclaimed Cremains of Veterans, Notification, Disposition, and Reporting. Delegate Kipke.
Thank you, Madam Chairman. This bill passed the Senate unanimously last year, but we ran out of time in the House. I say that because I'll try to keep this brief. Basically, what the bill does is it requires that the remains of a veteran that are unclaimed be handed off to the Maryland Veterans Administration. This is something that's already happening, and there are federal funds that help them honorably dispose of the cremains in a manner that's respectful. And that's what the bill seeks to sort of button up. It closes a loophole pertaining our law and giving the unclaimed remains of veterans an appropriate disposition. There are multiple department letters in support: Department of Veterans Affairs, Department of Health, Board of Morticians and Funeral Directors, 16 veterans organizations, the Maryland State Funeral Directors Association, and I'm told the Veterans Caucus letter will be coming again this year soon. My senator is the cross-file. He's worked collaboratively with the Department of Veterans Affairs, the funeral directors, et cetera. And this is a consensus bill. No one is in opposition. Maryland, along with many other states, recently passed a wonderful law that allows for the notification and appropriate disposition of unclaimed remains of veterans and their eligible dependents. Working with such as Missing in America Project, thousands of unclaimed veterans have received proper burials across the nation. Nationally, there are over 100,000 unclaimed remains. Approximately 25% unclaimed are veterans or eligible family members. There is a process if a veterans organization takes the unclaimed remains, and this bill specifies that if that happens, the veterans organization does not take, basically this only applies if the veterans organization does not take it. It would go off to the Maryland Department of Veterans Affairs. The department advises that while limited, they believe enacting this bill would affect approximately 10 unclaimed veterans and eligible family members annually. We, I know, share a desire to ensure that every veteran and their eligible dependent is honored and properly buried. With that, I ask for your favorable consideration. Thank you.
Thank you, Delegate. I'd like to call Patrick Gibau. Mr. Gibau. From the Maryland Military Coalition.
I see that he's in the room, but on mute.
Okay. Mr. Gibau, please unmute. Uh-oh. Is there a technical difficulty? Melissa, do you have any indication of what's happening?
No, I don't.
If Patrick is not able to speak, I'll draw your attention to written testimony that has been submitted for the members of the committee that's uploaded and online.
I think he's unmuted now. Maybe he can try again.
Patrick? So
yeah, sounds like he's having the same problem Dr. Thomas did. Okay, then. While he sees if he can get in, are there any questions for Delegate Kipke? Okay, seeing no questions. And do we have any I see him. He's unmuted.
Maybe his volume is down. Can you turn his volume up?
Oh. Okay, I think the technology is going to get the best of us this time. I am so sorry. But please know, Patrick, that we will read your written information, and we honor your service. Thank you very much. With that, that concludes the hearing for HB 604 and the work before the committee today. Thank you all for your time and energy and commitment. Take care and have a great evening.